This episode of Why Did I Become a Doctor is brought to you in partnership with Medical Brief, South Africa's leading daily healthcare news service.
Stay informed with trusted reporting, expert insights, and analysis that matters to healthcare professionals. Subscribe free at medicalbrief.co.za/subscribe. Dr Ninakhulu Ntsanwisi.
Hi, Yash.
How's it?
I'm fine. How are you?
Good. The doctor who became a lawyer, who I think is now a podcaster, maybe. Who knows?
Wow, that sounds like you, but real. A real doctor.
Real. But you're not the first, eh? I don't know if you know, but you're not the first medical doctor that's become a lawyer that's come onto the show.
No, I wouldn't believe I am.
No, but I would have thought you are, because I thought it's like a unique thing, you know? But it feels like every other person's doing their LLB these days.
Literally. But I mean, how many people actually get admitted?
Well, are you one of those snobs where if you look at the lawyers are like that, eh? Oh, they just got an LLB. They're not really a lawyer, because you can't technically call yourself an attorney
Until you've been admitted.
Absolutely. Right?
Gone through the grind.
Yeah, and you've been through the grind. I mean, and you know, we have something in common. We've got a common ex-boss.
Yes.
Great boss.
Absolutely.
Yeah, Maria.
No, completely. Absolutely. Yeah.
Before we get into it, I mean, we interviewed the Minister of Health a few episodes ago, right? And I don't know if I was projecting or what, but I said to him that my perception is that medicine has a bit of a bad PR these days, and nobody wants to study it. And he disagreed with me. He said, no, people really want to study medicine.
I agree. A lot of people still want to study medicine. And I think a lot of people are struggling to actually get in.
Okay.
I don't think there's bad PR on the medical front.
So
I don't think
there's still demand.
Can be high. I think the demand is high.
I don't know.
Do you think he said that? I think he did say that medicine has dropped off the scarce skills.
No.
list.
So he disagreed with me. He said, because I told him this thing about it's no longer sexy and people don't want to study it. And he said, no, people want to study it. The people are actually, like, students are actually battling to get in.
Yeah.
But what he did concede on was that people have more choices now.
Yeah.
You know?
Yeah.
It's
absolutely.
no longer.
Listen, I think people have realized that it was never sexy.
Yeah.
You know.
I think so.
Yeah, no. I think medicine had prestige, and I think some of that prestige might be gone. But it was never sexy.
So why'd you do it?
Wait, so can I just ask, what is your guys' definition of sexy?
Bankers. You know, mergers and acquisitions in law, I think, is sexy.
Yeah, lawyers. I mean, I think it all depends on whether there's a series that makes it sexy, like Suits, Scrubs. There's nothing about dentists.
For me, it was Chicago Hope.
Chicago Hope was the medical thing.
Hope was what made me...
There was a drama, though. There was no comedy involved.
No, there was no comedy involved.
No ER, no Grey's Anatomy, all that.
Grey's Anatomy came a lot later. I was already in university when Grey's Anatomy came out.
That's been going on forever, though. Madreamy died this week.
Yeah.
McSteamy died.
Okay, yeah.
So for me, it was Chicago Hope. It was a doctor called Kate, and she was a cardiothoracic surgeon. And I just thought, wow.
Really? So that's it. That's what inspired you to do medicine.
I mean, I think it was a little even before then. I just thought that was cool. That was the cool factor that, you know, that I got from TV. But I mean, ever since I was a kid, I was always very curious. My mom had a bit of a stint as a nurse, so we had all sorts of books at home, you know, medical books, nursing books, etc. So I was always just very curious about it. So I think that's where it started. But I think also, I just didn't know what to do. And it was one of the things that was always on my list of, oh, this would be really nice. So, I mean, you're 17 and you have to make a decision for the rest of your life. So I applied for everything everywhere, but I knew I wanted to go to UCT. So
what's
put
everything?
That down.
What's everything?
You name it, yes.
Yeah?
Engineering, law, medicine, everything, everywhere.
No dentistry.
No.
Why not?
I told you I'm scared of
Why
dentists.
not? Why didn't you apply for dentistry?
It's the drill, guys. It's the drill. Like, terrifies me. To this day, I'm scared of going to the dentist.
And now we're recording it.
You've got great teeth, yeah. And you're sitting on a Saturday afternoon with two dentists.
A lot of money.
When did you realize that medicine was not that sexy?
When I had to wear adult pajamas 7 days a week and tackies.
That's
Adult?
Scrubs, right?
Yeah.
Oh, okay.
Yeah.
Adult pajamas.
Adult pajamas and
I like
khakis.
that. I'm going to use that.
So that for me was a no. But I always, like, I had mine, like, tailored, and I would match my socks, and I'd match my khakis, and I'd like 24 sets of scrubs. It was a whole situation.
But so this must have been after qualifying, because was Scrubs a thing when you were a
Yeah,
med student?
we got scrubs as a gift in final year.
From
Finally.
Tank.
Okay.
And I stuck with Tank
Yeah.
my entire medical career.
Even now.
And when
no.
up until very recently. And literally when Jed, the guy that owned Tank, he used to have his store was out in Orange Grove. Like, I knew Jed from back then before we became where he is now. So Tank has stuck me through.
Yeah,
It's fantastic.
But there's some really sexy, for the actual definition of what sexiness is, scrubs out there nowadays.
Yeah.
Phenomenal.
It's
No.
like you're sounding way too excited.
No,
when
but
describing
they
these
really are
scrubs.
nice. Like, I look at them and I'm just like,
Okay.
maybe I would have stuck it around a little longer.
No, they actually make you the fit and the cut and everything. They're almost like joggers.
Even though
But the
the
pricing is
elastic
yeah.
it doesn't sometimes.
But that's why I was asking, because like Scrubs is a relatively newish is it not? Aren't Scrubs like relatively
Look,
newish in
I
healthcare?
think they're newish in the sense that everybody now wears them.
Yes, but it wasn't like
It wasn't ubiquitous with
yeah.
medical practice. I think you wore scrubs when you went to theatre, you took them off and you wore your proper formal clothes. Whereas now you can go to work in scrubs, work in
Exactly.
your scrubs and go home and hopefully leave them at the door
Yes.
and then carry on.
Yes, so it wasn't always ubiquitous, as you
No.
said. And then it started off as adult pajamas, as you
Yeah.
described them. And then as Yak says, no, I don't know, he sounds way
now
too
it's like
excited.
now it's like lingerie.
Yes.
Is this why you're still practicing? Yak? Anyway, no, so okay, Nina,
The
then
appeal.
you became a lawyer. But let's rewind. Like, where do you come
Totally.
from?
Where do I come from? I come from a township in Limpopo outside of Tzaneen called Nkwankowa. I'm born and bred there. I went to school in Tzaneen and then at a primary school called Unicorn. And then I went to high school at a place up on the mountain in Makweskloof
Isn't that
called
where
Stanford.
Tito is from there? Tito Mboweni.
Yeah, so his house,
Yeah.
the most recent house where he was at, that was actually down the road from where
Okay.
I was at school. He's not actually from there, but his house was there because he's from another village further down the road from my actual hometown.
Yeah.
So yeah, but yes, yeah. And then went off to Cape Town and
Well, that escalated quickly from Limpopo to Tzaneen area to Cape Town.
Yeah.
What were you like as a school kid?
I think it's something that I still am. I just enjoy studying.
Okay.
I just thoroughly enjoy learning new things. So that for me was always very interesting. I can't spell, could never spell. So Friday spelling tests were always like palpitations and disaster. And I actually don't have a doctor's handwriting, so now it's really awkward when you can't spell.
And you're legible.
You know what I mean? It's really awkward.
I feel like that's probably why a lot of doctors have bad handwriting, just to
Because they can't spell.
cover up the typos.
Yeah, but you see, what happened with me is that I literally, and this was in university, my handwriting was always good, but in university I was like, if I'm going to write nonsense, let me not like make the marker upset by having to try to decipher what's happening. At least I'll be on some, shame she tried, So yeah, I've always just enjoyed.
So you're the studious type. You weren't like playful and naughty and
Look, I probably was according to my mother's standards.
yeah.
But in my books, I think I was.
How many
relatively
siblings? I know
studious.
one is a lawyer. 'Cause
Yeah,
she worked with me.
Fezi. Yeah, so Fezi, my baby sister, she is a lawyer. She's actually doing a PhD now.
Oh.
And then we have a middle sister, Manelisi, and she's a teacher. So there's 3 of us.
Sure, 3 girls.
Wait,
Yeah.
PhD in law. What's that
Yeah.
about? How does that work?
Well, so it's
Arguing.
a doctorate in philosophy.
The
It's not.
Hmm.
So it's not an LLD. It's a doctorate in philosophy. So
Okay.
it's the same as you would do a PhD or anything else. It's just that her main focus is in the legal space.
Okay.
Yeah.
So another Dr Ninakhulu is lawyer.
Yeah. So now we need to differentiate between MD
Yeah.
and PhD.
And your parents? What were-
So my dad actually studied law, didn't practice.
You got an LLB.
There you go.
Yeah.
Yeah. So my dad studied law, but my dad's a chief, and then my mom, like I said, she did a bit of nursing, but her passion was always going to teaching. So then she went into teaching. So she's a teacher, but they both retired now.
So daughter of teacher and chief.
Yeah.
How's that? Is that cool?
Like, sorry, chief of?
He's a traditional chief.
Okay.
Yeah. But I mean, he's a lawyer, so it's the same.
So all the kids must have
thinking.
respected you there. Well, what was it like growing up as a chief's
I went to
daughter?
white school. It didn't matter. It's still.
Oh, okay. They don't know.
Yeah, they don't
It
understand
could have been
chieftainship.
anything. It was a lot of interesting explaining growing up, I guess.
Yeah.
So
You must be tired of it. Like what?
No, but I mean, now people are more knowledgeable about everything.
Okay.
So now they
Clearly not Yak and I, because Yak is like, chief what? Chief of what?
chief of staff.
Yeah. So white school. So you went to a white school in Limpopo.
Yeah.
I didn't even know.
I went to a white
Look at how
school in
ignorant I am. I
Limpopo.
don't know those existed.
Listen, they do, hey.
Yeah.
And for a while, I mean, even since like preschool, my parents, they still do. My parents just wanted to make sure that we got the best that they could, afford to us. So I think since about the age of 3, we were put in, then Model C schools, I suppose you can call them that. And yeah, that's formative years. I guess we were token kids for a bit.
And when does the medicine thing comes in matric around then, standard 9? The decision to just apply for
standard 9.
Just give a shot at everything.
It was standard 9. You apply using, what is it now, grade 11?
Yeah.
So you apply using those marks, to all the universities. So I applied standard 9, got a conditional acceptance.
To UCT.
And took it and ran. Yeah.
Why UCT?
Wait,
Why not UCT?
Before you even get there, like, I'm sorry not to belittle your profession, either one of you.
Which one?
Either one of you. But like you mentioned chief now, and I'm super excited about that. Tell us more about what does that chieftainship mean? What is your dad's responsibilities?
Oh man. So I mean, it's.
And how did he even get the position?
He was born into it.
Okay, so like royalty kind of vibes.
Yeah.
Cool.
So I mean, yeah, exactly. I mean, that pretty much explains the whole situation.
Yeah.
But what is his role? What does he have to do?
So say a lot of it. So let me start at the beginning. So as you get a lot of traditional communities like in the country, everywhere, and some of them have kings and queens. So I'm Tsonga, and in our culture, we don't have a king or a queen. There isn't one, superior family to another family. And then, so we all have chiefs, but we have different, for lack of a better word, tribes, I guess, within the Tsonga people. Let me put it that way. And the Majeja community is where my father is chief. It's out in Phalaborwa.
Majeja.
Yeah. So just outside of Phalaborwa. And the responsibilities are it's a leadership position. You know what I mean? And so it is. You are. I don't want to use the word in charge, but you are sort of.
It's an advisor.
Not advisor, but you are put in the position to ensure that the people's best interests are looked after. I think that's the best way to put it. So the communities have, say, farmlands, for example. All the proceeds from those farms belong to the community. The land belongs to the community. But then the buck has to stop somewhere. So somebody has to be the person that says, okay, we will invest in this particular thing, or, we will farm this particular fruit or crop or whatever, or we'll lease this farm, etc., etc. So things like that. And then also to be there, there's a whole other, what's the word? Say for example, like a parliament, for example, where there's a traditional house of leaders where, all the different traditional leaders will get together and discuss the affairs that obviously involve them and their people. Because you can imagine that problems that we have here in Johannesburg are completely different to problems that somebody is going to have in the middle of Lulekani, you know. Ours will be potholes. Theirs will be somebody coming to
Stop theft or something.
you know what I mean? Or even, stomping the roads to make sure that everything is flat because there's no tar roads.
Yeah.
So you had to be well behaved.
All the time. I still do.
Yeah, because I mean, there's that responsibility, right?
Yeah.
I think even more than just that, it's just the where I come from is small. The community is small. But to take things even further back, my grandfather, my dad's father, was a chief minister of a homeland. So, there's always everybody knew who
the family name
we were. Everybody knew the family name. Everybody knew, this, that, and the other thing. And maybe that was another reason why I ran off to Cape Town.
UCT, I was about to say.
There we go.
We got it. Yeah.
Because you're nobody.
Yeah.
So you can be anybody.
Yes.
When you get to the other side where they speak a completely different language, they
princess story.
Yeah. Now, do you have a title?
Yes.
What would it be?
Princess. Really? Wow, it's so cool.
You need to update your LinkedIn.
Yeah.
Seriously.
I feel like we should have bought.
I didn't see this on LinkedIn, Nina.
That's not there.
Okay. But you can. Yeah.
That's so interesting because we're from KZN. I mean, the only thing we do know, I think especially me.
Don't say we, I don't know anything. Yeah, go on.
Because I'm from up north.
Yeah.
The King Lovo Zululand
100%.
is the Zulu kingdom.
Yes.
And I mean, it works along the similar sort of hierarchy, but you honestly don't think it exists anywhere else outside because that's what we're used to.
So, it exists everywhere.
We also live in our bubble. Like I'm sure people watching this will also be like, I didn't know that existed, that kind of thing in South Africa, let alone. There might be people outside that know more about those kind of arrangements than we do. How ignorant we are. And we don't get taught these things in school, right? I'm guessing
there's a lot that doesn't get taught.
In Model C, school didn't teach you all that stuff?
No, nothing.
Yeah.
Nothing.
Because I also went to white schools from a young age.
Yeah.
Never learned any of that stuff.
No.
It's a pity.
It is a pity.
Yeah.
It is a pity. And I think there's a lot of our history that, isn't taught, which is a real pity.
Yeah. Last week we spoke to an actual freedom fighter guy who was like crossing the border,
people were after him.
People were disappearing.
And I had no idea that this guy, I don't want to give a spoiler, but even technically it won't be a spoiler, but still, it's really interesting. Okay, but let's go back to you. So you wanted to get away from the chiefdom and you wanted to be yourself, let your hair down a little bit, go to Cape Town. But you could have gone to Wits, you could have gone to Pretoria.
I could, but Cape Town is beautiful.
Okay.
Also, let's face it, UCT is UCT.
And had you been to UCT?
So I'd been to Cape Town when I was 12. When I was in school, when we were in primary school, they have a Cape tour. I don't know if it's still going on now, but when you're in grade, what's it now? 6 and 7.
Wait, Unicorn.
Yeah, standard 4 and 5. So in standard 4 and 5.
That name though, come on guys.
Unicorn Preparatory School. Yes, because we're all unique.
Ah, come on.
Unicorn.
Like seriously, shout out to Unicorn Prep. What's it, Unicorn Prep?
Yeah, Unicorn Prep.
So it wasn't an Afrikaans school. I'm assuming
English.
In my head it's a farming community.
No, very English. Like super English.
UNICORN, like the horse thing.
Like the horse thing.
Yeah.
There was an Afrikaans school around the corner, Laerskool Tzaneen. So no, but we went to the English.
What languages did you speak there in Tzaneen? Like what are you fluent in?
Oh, I'm fluent in English, Afrikaans, Tsonga, Zulu, Pedi.
Sure.
Wow.
How many is that? 5?
5.
Yeah.
That's embarrassing part.
No, we had this conversation in a previous episode where it's like, in South Africa, if you speak 2 languages, it's like you average.
Like I can
below
speak
average.
Zulu and Xhosa, but I can speak Xhosa, but it's a little shaky.
And Tsonga is Shitsonga, right?
Shitsonga.
We've had a previous guest who's Shitsonga, Casey Makubele, the CEO of SADA.
Yes, yeah.
Yeah. I think he's from Mata, I can't remember where. Somewhere with the MATA in the beginning. We digress now. What were we saying? What were we talking about? Oh, Cape Town. Have you been to Cape Town? You've been there?
Yes, that's where we were. So standard 4, we went down on a Cape tour. It was actually a fantastic, I think exposure is so important, like in life.
Okay.
You know what I mean? Exposure is, it's literally a game changer. And I
Yes.
think if there's one thing that I could do for younger people is to expose them to things to make them realize that so much more is possible, you know, in the world. So in standard 4 and standard 5, you fly down to PE, and then you literally drive down the garden route. We even got to go on the last coal steam engine train that is down there. We went to the tallest tree somewhere there in the Titicaca.
Mm.
We saw the Titicaca Bridge, you know, all this stuff. Mossel Bay, you name it, up until you get to Cape Town. You get to Cape Town and you spend a couple of days in Cape Town. You see all the Cape Town sites. You go to the university because UCT is one of the open universities that we have in the country. So you can literally just drive up there and see everything. And I was just like, wow, you know, you've got your mountain, you've got the sea. It's fantastic. And it was far. So I was like, you know,
Yeah.
this is where I want to be.
You standard 4 and standard 5.
Yeah.
Have you been to UCT? Yeah.
Mm.
It's beautiful. Like
Fantastic.
it's unfair.
But can I tell you, you go there and you see, I mean, you're driving into Cape Town, you're flying into Cape Town, whichever way you get into the city, and you see upper campus, and you think that's where you're going to be in
It's like
school.
monumental.
Listen, it's fantastic. You think that's where you're going to go to school. Nope. You're like a med student. You get tossed somewhere there in the middle of nowhere.
That's what happens to the med students
But
generally,
you know what I-
everywhere.
And then, like, we would get to go to upper campus once a week on
Yeah.
a Friday to do chemistry and physics.
Yeah. It's
And
engineering.
That was it.
It's engineering department or BA. Upper
So
campus.
upper campus is everything except for medicine, arts, and by arts I mean fine arts.
Yeah.
And law, because law is middle campus, and then medical school is medical school, and then fine arts is in Hidding. So
you knew Cape Town was a thing from grade 7, grade 6
Grade
ish,
six,
that
yeah.
tour.
yeah.
And then you applied and got into UCT. And what was it like transitioning from Limpopo to Western Cape?
It
Your
wasn't
parents to send you off
even-
and leave you?
that wasn't the transition for me.
Yeah.
I went to high school. I mean, let me give you an idea. I went to the most beautiful high school in this country. People will say whatever they want about where they went to school, but I went to the most beautiful high school. It's on a mountainside and it overlooks 2 lakes. And the school literally starts at the bottom, where you have a recreational center. At that point, there was even a barnyard and a climbing wall. And then you go up and it's the hostels. And then you go a little bit further up. It used to be an old hotel. So the main hostel actually used to be where the hotel actually stood. And then you go further up and it's the classrooms that are structured in an amphitheater. So you're overlooking these lakes.
What's the
as
name
you
of the
are.
school?
Stanford Lake College.
Okay.
Sure, it sounds like it's
It's beautiful.
Lani.
And over
Yeah.
time it's gotten
Yeah.
even Lani. Yeah.
Yeah.
And
Did you board there?
yeah.
Because you said hostels, and I'm thinking, okay, it's giving boarding.
Yeah, no. I was a weekly boarder, which
Yeah.
they say isn't real boarding.
Not really,
My
yeah. 'cause
husband says it's not real boarding.
you're not spending the weekends there.
No,
yeah,
you're not
yeah.
spending the weekends there. And they did our washing for us. He's like, you are definitely not in real boarding school.
Yeah, look at this thing.
sounds like a hotel.
Look at it.
How come we've never heard of this?
I don't know. It's
Wow.
Limpopo.
They only advertise overseas. Like,
Well, it's for royalty only. Jeez.
no,
It looks really cool.
It is
Damn.
absolutely
Shit.
gorgeous.
Yeah, no, you're
it's like
right.
Michael House Hilton vibe.
You're right. Yeah, it's better
With
than
the
it's
lakes,
better than
it's
that.
better than them. You know what
Yeah.
I mean?
Stanford Lake College.
It's absolutely
So
beautiful.
how far away from your?
52 kilometers from home.
Okay.
You could have been a day student if you wanted.
There were lots of day students.
Yeah.
But it was very small. At the time that I was there, it was very, very small. I mean, you can just think about this. In matric, there were only 48 students
Sure.
in
Mm.
matric. That was the entire matric class, split into 2 classes. So, and my classmates then were people that some people I've known since I was 3.
Okay.
So we literally have just grown up together. And also I think there were maybe like 8 black kids.
I was going to ask, what's the demographics like? So
In
you're
that
mostly
course.
white?
Yeah,
Okay.
yeah.
And students from around the area.
So students from around the area, because it's a lot of farming communities in the Limpopo area, obviously. But also a lot from Johannesburg, because parents wanted to take their kids out of the city,
Yes.
somewhere. A lot of kids from Polokwane, same reasons. And then we actually got a lot of people who are coming in from Botswana.
Okay.
Quite a lot of people coming in from Bots. So, I came from a place where I knew everybody, very small, and the boarding situation. I had a what's this? I had a, what do you call them?
Yeah.
It's not a housemate. It's a roommate.
Yeah.
Yes,
Roommate.
I
Yeah.
had a roommate.
Yeah.
Just one roommate.
Is it co-ed?
Yeah, it is co-ed.
Okay.
I had a roommate.
Obviously a girl.
Yeah. And I mean, we shared, maybe amongst 6 of us, we shared one bathroom, so very few of us. It was always clean. It was just very homely.
Yeah. Very privileged.
I mean,
Yeah,
yes,
yeah. That's
that's
what I'm
the
getting.
truth of it.
I'm not getting the word homely.
No,
I'm getting the privilege.
that's the truth of it.
Yeah.
But I guess it felt homely because I've known everybody all my life.
Yes, of course.
And then you go to UCT, and I think the other thing is that it's a private school, and private school comes with private
Yes.
school things.
Private schools are more expensive than universities.
They are.
Yeah, in
They
South
are.
Africa.
Yeah, I'm thinking at this point, UCT would be like a step backwards.
Step down.
So not at my school, not then. I don't know what it's like now, but like then it was, it was still UCT. And then, but for me, the shocker was going into res and being exposed to different levels of,
Socioeconomic.
you know what I mean?
Yeah,
Exactly.
welcome to the real world. Rita.
That
That's
was
not even the real world.
literally it. It was, and it's still, that's not even the real world.
Yeah.
So that for me was the biggest thing, but it also was such an eye opener, because it exposed me to so many, different things, and I think it ended up helping in the medical career, because when you're seeing patients, it's not going to be just your friends and family. You're not going to be seeing the same things that you're going to be seeing in Santon Mediclinic that you're going to be seeing in Tembisa Hospital.
Yeah.
It's going to be, chalk and cheese. I think that made for a good introduction into,
Which res were you at?
Oh, yes,
Yeah.
Rochester.
Rochester.
Oh, I
okay.
hated every minute of it.
Why?
There was nothing to love.
Tell me about, so is it one of these small jail cell rooms, and you've got a communal kitchen and a communal
Yeah.
shower and all that stuff?
Yeah, that was it.
No, I get it. Now I
And,
get it.
yeah.
Don't worry. I totally. You definitely come from more privilege than I do, but yeah, I know what you mean, because now you've got to
Oh, it's
live with
terrible.
more than 6 people that you were used to. But so you were used to living away from home.
Yeah. Yeah.
But not among the people.
I mean,
Yeah, look, one of
The
my
real
colleagues is
people.
going to be really happy that we got you on, because she always tells me, yeah, she's tired of the rags to riches story. We get somebody from privilege to come in and talk about things. So own it, and
no, look, I
talk
do
about
own it,
yeah.
and I'm grateful for it.
Yeah.
You know what I mean? I don't run away from it. And I think that it is, let me tell you a story.
Yeah.
When I did my final year obs and gynae oral, I got into the oral, and you're supposed to be there. You come with your portfolio of patients. You're supposed to present your patients. Da 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 da. So I get there. I put my portfolio down, and I start my presentation. And the professor stops me. He's like, "You speak so well."
Oh,
Literally.
Yeah.
He's like, "You speak so well. Where are you from? What do your parents do?" Where did you go to school? That was my entire obs and gynae oral.
Oh.
I passed.
yeah.
But it wasn't because,
Fascinating.
unless of
stuff.
course you read something that was world changing on that
Yeah.
page.
I mean, you do own it. I think what Yash said, but I think you're very humble about it, because if we didn't pry, we wouldn't have known you're a princess. You come across very
How many other princesses do you know? Yeah.
One actually.
Oh, do you?
In Kathmandu, yeah.
Oh, and how's she?
She's pretty chill. She's also she's in Pete's, but she's in Manhattan.
Maybe that's a
Got a-
princess thing. They're very humble people. How do we know?
Maybe.
Why do we have this expectation that a princess is good? Oh, maybe
The movies.
because they say, why stop
From-
being like a princess? Yeah,
Exactly.
Yeah,
Yeah.
okay, I
From
get it.
childhood.
Yeah, I answered my own question. Sure.
Yeah, but well done for your
No, but
humility.
the guy that said it, was he white?
Yeah, of course.
Yeah, okay, that's
Yeah.
yeah. No, I mean,
You know what I mean?
yeah. So it's one of those you're well spoken, you speak so
Yeah,
well
you
types.
speak so well.
That's such a like a cliche type of thing. It's
Mm.
And like, I literally was so surprised. I was so super surprised.
Was that your honest emotion?
but imagine
surprise.
Imagine if you
It
or
was
disappointment?
it was surprise. No, it was surprise because I I I I've always spoken as I have spoken. And I mean, growing up, and like I said, I mean, I was in a white school since the age of 3. So even now, like I speak to my son in Zonga, and people are like, and I'm like, I didn't grow up speaking English until I went to school, because they're like, oh, you're putting him at such a disadvantage, all of these weird and wonderful things, and I'm like, no, I didn't grow up that way. So why should I now cut my son away from his grandparents, from his, you know, is half of his people?
Yeah, it's heritage, yeah.
You know what I'm saying?
Mm.
Because language is the first thing that you get in. So I literally was just like, what do you mean I speak so well? This is how people speak. Did you expect me?
In your mind, right?
In my,
You're
oh, of
thinking,
course.
Yeah.
I
But
just wanted to pass.
yeah.
Yeah.
You had to have known that you had a very unique set of experiences
Yes.
that would have been seen as different to other people.
No,
Yes,
no,
I
no.
did, because I did know, because say, for example, I have a friend who has done like very well. But when he came into varsity, right, he had never sat across the table from a white person. He had to, he thought in Xhosa, so he had to think in
Translate.
Xhosa, translate, and even if we had to write something down, he had to write it in isiXhosa, then translate it into English, and then type it. Do you get what I'm saying?
Yeah.
Whereas, like, somebody asked me, do you dream in English? And I'm like, I actually don't know. You see what I'm saying? So it's not that I wasn't aware of it. I didn't know any different for myself.
Mm.
You know what I mean?
Yeah.
I didn't expect anybody to tell me I speak well.
Mm.
Because I think, and it also was, I suppose now when I think about it, I think, which is really unfortunate, I think that as Black people, and maybe I can take it so far as to say as Black women, there's a presumption of incompetence. So I think when I get there and I'm speaking, I was like, oh, maybe you know something. You know, I mean, that still happens to me to this day. So maybe that was just the beginning back then, you know, of...
And if you think about it, he didn't ask you anything technical, right?
Nothing.
Yeah. So what you're saying is probably true. He's like, okay, she's sharp.
Yeah, she must know something. You know, it's almost like pretty privilege, but I suppose accent privilege.
Accent privilege,
Yeah. And I think that's also a real thing. Accent privilege is a real thing. If somebody comes and speaks in an accent that isn't resonating well with you, there's a part of your brain that will switch off and be like, oh.
Yes. Because all he's basically saying to you is, well, you've got a private school accent.
Yeah. All he's saying is that you measure up.
Yeah. We've got a funny story because one of Yak's friends knows both of us, Yak and me. And he says to me, Yash, how come Yak speaks so nice and so well, but you guys are cousins, but you speak so different? I'm like, hold on. Firstly, Yak twangs, that's why. He's with white people, he twangs. And secondly, he doesn't speak so well. Like, he doesn't speak so well.
How do you know I'm not twanging when I'm on the Indian?
He doesn't speak well. That's just his accent. You know, don't get it twisted.
No, but can I tell you something? I think Indian people code switch so well.
The ones you know, maybe, yeah.
like you know, code switch so well.
Code switching is a nice way of saying twanging.
No, actually, like, you know, there are people who will twang.
Yeah.
But say, for example, if I were to not be in the room, you guys would be speaking as you would be speaking.
In our code, yeah.
Exactly. You know, but as soon as somebody else comes into the room, the y'alls go away.
Yes. Exactly.
You know, the see him, see you, that all goes away. And it happens so quickly. It literally, blows my mind.
Okay, but Yak is a twanger. He's not a code switcher. we'll just leave it at that.
I tried, yeah.
I'm a coder.
I tried.
So, like, do your parents go and drop you off at Res from, like, do you all fly down and then They drop you off in
Yeah, so
mums in tears.
my parents dropped me off at Res.
Rochester, yeah.
Yeah, listen, I cried.
You cried.
Oh
Okay.
my god! I was like, no, don't
Why?
leave me here.
Well, you chose this. Then you
Yeah.
wanted to
I
go to Cape
did,
Town.
but I wanted Fuller.
Oh gosh.
I wanted
Pity.
Tagwell.
Such a
Like,
princess.
you know,
Wow.
like,
Yeah.
come on.
Fuller houses. That's
But how do
the
you even know about
prestigious one.
how do people know about what the houses represent and what they bring?
How do you not know? Don't
I
you
don't know.
research where you're going?
No, not at all. No.
Oh no, I did.
And what did you hear about the other houses that were different?
No, it's just like it's that thing. They have the prestige, they have the fun, they have
Why didn't you get into it? How come?
Because I was in med school.
Oh,
Proximity.
okay.
Proximity. Because you'd have to get on a jammy.
Yes, those was buses, right?
I think they're called something different now.
Right.
But yeah, because it's definitely something different. I wonder what it is. But yeah, because you'd have to get on a jammy, whereas from Rochester, Clareness, or Clarendon, you could literally just walk to med school. And if ever you were working or whatever, you know, if you're in GSH, you could still, when you finish your shift at 7 p.m., you could just walk back to wherever you were staying. So
GSH is Grootersdorp, right?
Yeah.
That's the academic hospital linked to the
Yeah.
to university.
Yeah.
So you were crying. Your parents were like, "No, you'll be fine. Don't
yeah,
worry."
I was like, it'll be fine.
And how was it?
And like, so for the first 3 years, every time I came home, I was like, I want to go back. I'll transfer, I'll move to Wits.
So the first how many years?
3 years.
Yeah.
I wanted to
That's a-
leave every year.
Really?
Yeah. And I didn't, it wasn't necessarily wanting to leave medicine. I just really disliked Res that much.
I get it. So why didn't they? I mean, they should have put you in one of the. Oh, but Cape Town's expensive.
No, so I had to write like a motivation for my dad.
Yeah.
So no, I
To-
had a
to your dad,
business
to the
plan.
chief, yeah.
I literally had to put down a business plan to be on some. This is how much you're spending on Res. This is how much we'd spend outside of Res. Da 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 da.
Yeah.
Put it down in paper, for approval from the chief. And that's how I managed to finally get out of Res, to be on some. It just doesn't make sense for me to be here.
So you moved to Diggs, I'm sure, like a cohabitation.
No,
Yeah.
so a friend of mine, we got into an apartment, and we were there.
But what was so
for-
bad about Res?
It was just terrible, man.
Yeah, just sharing and did
All
you go
of
to
it.
shower in communal showers?
I think how I actually managed to get out was in 4th year, you go to Medres, and Medres is proper co-ed. Now, think back to a time, it's the residence that is on campus, like on medical school. It's fantastic for the fact that it's on medical school, literally at the door of the library. So back then, when it was all started, there weren't any female medical students. So it was all males. So one time my dad comes to visit me and he's like, where are the bathrooms? I'm like, over there. So he goes to the bathrooms. There's the bathroom stalls are here. There's urinals here. Then there's showers there. And there's bathtubs over here. So my dad obviously walks in,
Open
sees
plan.
the urinals. He's just like, where's the girls' bathroom? I'm like, that where you went is where we all go. And I think that probably pushed my
Yeah.
You should have made him go to the bathroom sooner. Like
Listen,
first year,
I
second year.
I'd moved to a different res.
Oh yeah,
Yeah, this was a new.
Yeah.
yeah.
Back the first res had blocks for girls and blocks for
Okay,
boys.
yeah.
Yeah. So they were still safe. So I think that's
And med school itself, how was that?
I think med school, once you get past second year, you're fine.
Anatomy in second year. Is it,
So
what's the killer subjects?
nothing. I think the for me, it's not that anything was particularly killer, but I prefer the hands-on things. And once you get into third year, you get into your clinical years, so it becomes more practical. You're not looking at some histological sample and they're telling you it's purple and you're sure you're seeing green. So it's a lot less abstract. Those first 2 years, I mean, it's chemistry, it's physics, it's histology, but it's not coming together quite yet. And I think once you get into third year, you start interacting with people. It starts becoming a little bit more practical and less theory. So it just becomes more enjoyable, I guess.
More real, huh?
More real.
Yeah.
Yeah, definitely more real. Definitely.
But you were willing to give it all up.
No, to just move to Wits.
Oh, you wanted to come to Wits.
I just wanted to, you know what I mean? I just
Wits.
was like, I don't want to be
Joburg,
in
compared to
this.
Cape Town.
In this.
Did you even enjoy Cape Town, like as a
I
med
loved
student?
Cape Town.
Like, did
Listen,
you get a chance to?
Yes, no, I loved Cape Town. I mean, in final year, I don't know why they did this to us. They were really trying to sabotage us. They had lectures in final year on Fridays, Friday afternoons. I mean, Cape Town, come on. You're just asking for trouble. You know what I mean? There's the beaches. And Cape Town, the nice thing about Cape Town is there's a lot of activities you can get into for free.
Okay.
You know, you can go walking, hiking. You don't have to pay for a lot of that. You can go to the beach. You don't have to pay for that. As opposed to Johannesburg, where everything you have to pay to play. So I actually really enjoy Cape Town as a place. I still do, but just to visit. I wouldn't live there again.
And the classmates and stuff? Good friends? Did you make friends?
Yeah. I mean, a lot of my friends were also in Stellenbosch. So I spent a lot of time in Stellies as well. Which was also fantastic.
I have this impression that UCT students come from far and wide, and it's not like. So, what was it like? Were there lots of international students? And
They
stuff?
were.
Yeah.
They really were. Not so much studying medicine.
Yeah. What was it like? Mostly South Africans.
Yeah.
Yeah.
But you know, from other, the nice thing about having been in Rochester is that you know, we had students from everywhere, in that they were studying different disciplines, and so you got to mix and mingle with, you know, a whole lot of other people, which was fantastic. I think the other reses might get a little bit more of that. But I mean, also by the time my sister went to UCT, we thought she was running the, what's it now? Now it's called the AU, but back then it was the OAU. You know, because she had literally friends.
What's that?
African Union.
Oh, okay.
She had friends from everywhere, like the continent.
Yeah, I get you.
You know, I mean, she was in Uganda the other day for a friend's wedding. So yes, I think you're quite right. It is a great melting pot for people. Joburg is a great melting pot for South Africans, but I think Cape Town is definitely for Africans.
Yeah. And any horror stories from med school? No. What was it like? People don't really talk badly about UCT. Well, we don't know many UCT medics, do we, Yak? Do you?
Yeah. Personally, I do.
Yeah.
No, there's nothing bad to say.
Nothing bad at all, huh? I feel like they
maybe we drowned it out.
Yeah, I don't know.
Yeah.
Trauma block.
Protecting the legacy.
Yeah.
No, like I couldn't. Yeah.
Has Stanford Lake College called you back to come give a talk or something?
So I actually gave a speech at my sister's valediction.
Yeah.
So I did that, but I haven't gone back recently. And I actually really do want to go back, because my English teacher in matric, Mrs. Thompson, I'll never forget her. She always just like, why are you going to go study medicine? Like, you know, you don't you want to go do law? Don't you want to? I actually found her a couple of years ago.
Because you speak so well. Come on.
Hello.
Yeah.
Didn't see it then.
Yeah. Talk about code switching from patient to client.
Literally.
Yeah.
So she was just like, you know, what about law? And I reached out to her a couple of years ago, and I was like, you know, actually, I actually went to it happened. So I was just like, oh wow. I'm like, yeah, I did it. I did it.
So tell us about, well, no, first, let's not go there. You qualified, right? Six years at UCT.
Yeah.
You passed every year despite wanting to leave in the first 3.
Yeah. No, my mother was just like, forget it. Because now you can actually leave after 3 years and get a degree.
Like what?
The BSc.
Yeah.
Oh.
Now you can. And you can even branch off into, you know, the sciences.
Yeah.
It's like you're selling dentistry, eh? Hard.
I don't think I'm selling it. I think, yeah.
So now you can branch out and, you know, become a scientist, you know, after 3 years, so you don't actually have to, you know, finish. Whereas back then, it was just like, nope, you either see it through or you quit, and, you know, you get nothing for your years of effort. So, no.
I know you finished in 2011, right?
Yeah.
Because I did some research last night, and then you have to do internship, right?
Yeah, 2 years.
Where do you go?
Polokwane Mankweng complex.
Why?
So I went back home. My grandparents, I was really very close with my grandparents. My grandparents actually lived down the road from us, so they served as a second set of parents. So I absolutely loved my grandparents. They were getting on in the years, and I wanted to be close to them. But also my baby sister was finishing. I call her my baby sister. She's a grown woman.
Always be your baby sister.
You know what I mean? She was finishing off high school, and I thought it would just be nice to be close to everybody.
Was she at Stanford as well?
Yeah. So the thing about it is that we were all we're very privileged and lucky to have very stable upbringings. You know what I mean? We went all three of us went to the same preschool. Same primary school, same high school. We've lived in the same house. You
had both parents and you had grandparents.
Yeah. You know what I mean? So very stable. So I just wanted to go back home, and I just wanted to just be part of that, because you're so far when you're in Cape Town. You know, so many things happen, and you're not part of it for a very long time. So I went back to PLK. Did my internship ComServe, and I actually worked there for a couple of years.
And ComServe also.
Yeah.
And worked there.
Yeah.
And you're the first doctor in the family? Or?
No.
Oh, what?
My dad's younger brother is actually a psychiatrist.
Okay.
My mom's youngest brother is also a doctor.
That's the coolest specialty. Psychiatry.
I think it's sad.
I think it's the coolest, man.
I think it's so sad. Can you imagine your brain betraying you?
I wanted to be a psychiatrist.
Oh, that's so sad. You're better off in dentistry.
Did you want to specialize in anything?
You know, initially, I thought radiology.
Why?
Sexy.
Is it sexy?
It really is. Can you imagine? This was my dream. So my dream was that you have like your little iPad or whatever it is, you know what I mean? And you're like shopping somewhere, but you're actually on call, and you just whip out the app on your iPad and you just look, and then you dictate your report, and you've done your job, but you're shopping.
Well, can be done anywhere in the world.
Okay, well, your idea of sexy is very different to my idea.
Both of your ideas of sexy is like...
Yeah, well, you're into scrubs, so stop. Don't even come here with your nonsense. Please.
But AI is kind of revolutionizing that whole speciality.
Yeah, no, but that's changed. There was a thing where people were saying AI is going to take over. There's going to be no radiologists. Apparently now there's more radiologists because of AI. Because AI is doing the stuff. It's allowing the radiologists to do what they need to do, like more doctorish stuff.
So the interventional stuff. So I mean, good for them.
So you were thinking about that?
Yeah, I thought about that, but then
because you wanted to shop and work at the same time.
Yeah.
What a motivating. Nice. Everybody has their own motivation.
You know what I mean? Everybody. For me, it was just the flexibility.
Yes.
You know what I mean? The not having to be at the hospital all the time.
Do they make good money? Radiologists.
I don't know. I never.
Which specialty gets paid the most?
Ooh, good question.
Yeah.
You know, sometimes when I read these medico-legal reports, when I see the invoices to the medico-legal reports, I'm just like, I left medicine too soon. Yeah, because those guys, you know, they're doing okay.
The radiologists.
No, the experts in the medico-legal field. Yeah, they're doing all right.
But you know what? Doctors say the same thing when they look at lawyers' bills, right? Or invoices. So
they're looking at the
firm.
They must take it apart.
The grass is always greener on the other side.
Sometimes there is no grass. We just don't know it.
Exactly. Well, you're going to tell us about that. Like, so when does so you did internship ComServe there, PLK, you call it, as you guys call it from there. Polokwane for the rest of us. The
Polokwane complex.
When does the law thing come in? Or the medicine disappear?
So no, I mean, I was in PLK, and after ComServe, I sort of fell into emergency medicine, right? Initially, it was in Mankweng, Polokwane. And then I was like, it's time to go, I just felt like things weren't, because I did my ACLS and ATLS, and then you get back into that environment and everyone's just like, I've been doing this like this since heaven knows when. And the actual reason why I went to those courses is because I don't, I think as doctors, we don't speak about the trauma we go through, right? My first internal medicine call as an intern, not ComServe, not anything, as an intern, I'm in casualty, It really was. One of my bosses, fantastic woman, she was just like, no, casualty is where they direct traffic. We are an emergency department. We actually treat patients. I was in casualty and I get a call from the medical ward, and in the background, while they're calling, saying this woman is crying of chest pain, in the background, you can hear her screaming. You can hear that this woman is in absolute agony. I'm like, I just qualified yesterday.
I just arrived.
Right? And so I go to the ward. I literally get to the ward, boom, this woman has collapsed. Right? I'm like, get the ECG, where's the resus trolley? There's literally no rush, no urgency, nothing. I'm like, call the senior on call. First he doesn't answer the call, right? Eventually he answers the phone and he's like, oh, I'm in Mokopane. I'm like, you're on call. You can't be an hour away. We have an active resus. She's like, no, just get on with it. I'm coming. I'm like, what do you mean? The defibrillator, they don't have like anything. You know what I mean? They don't have the gel. The defibrillator's not reading anything on the patient's chest. Is it on? Is it off? You actually don't know. So we literally are just there. 2 other interns come. We literally are just doing CPR on this woman. And at that point, I felt like I wasn't far enough in my career or knowledgeable enough to know, now I can tell you, have we corrected the H's and T's? Yeah. Have we looked at this? Have we looked at the other thing? Okay, fine. We've tried. There's nothing reversible. Let's call it. Then I didn't. So I thought that maybe this guy would come with knowledge and input and save this woman's life. He didn't come. Yeah. And after an hour, I had to be on there's nothing. At that point, this woman's family are pacing up and down the corridor praying. So now you're there, you have to go outside, tell them that, listen.
And you're the first year intern, right? Fresh out of Grooteskier.
So wait, this patient demise?
Yes.
She did. In retrospect, I think perhaps she either had like a huge, heart attack or she had a PE. But I don't know,
But her life was in the hands of a first-year intern, basically.
That's the problem. You know what I mean? And no one saw anything wrong with that. As a comserv in Obs and Gynae, 2 a.m, again, my senior is like not answering the phone. She's like not coming. She's like, no, we're not going to open a second theater. And this was the point where I actually was just like, this is where the law came in. She's like, no, I'm not coming. They're not going to open a second theater. It's me. There's an intern. Can you see how tiny my hands are? The intern's hands are even smaller. Like I was a size 6 glove. The size 6 gloves were big on her. This poor girl has been up all day, all night. It's 2 a.m. There's a primigrav who's been pushing for about 30 minutes. She's now been prepared to go to theater. In rolls a woman, previous Caesar, ×3, in active labor, 4 centimeters dilated, and booked. So now I'm there having to make the decision between that first-time mom and this woman. This woman is at risk of rupturing her uterus and dying. This woman is at risk of losing her baby. But the baby isn't recognized as a person. The mom is a person. The mom is a maternal death. She's got at least 3 other kids that she's already taken care of. So, at that point, a decision must be made. And she's the one that needs to, go to theater. So we switch. We take her to theater.
You call the shots here.
I'm calling me. Not
even a fully qualified doctor, really.
No, because I haven't done ComServe. I'm not an independent practitioner. Right?
Exactly.
This is my ComServe year. And then, and this is not a C-section I'm qualified to do. You know what I mean? Because if anything happens, this is a woman that's going to require a hysterectomy because she's not clotting, she's not doing whatever.
Wait, sorry, one quick side note.
Sure.
and forgive the ignorance, but you mentioned your hand size there.
Yeah.
Wouldn't
Oh, no, we're
smaller
getting
hands
there.
make things easier?
No.
No. Okay.
Because small hands, we struggle to grip things. It's just, or at least I do. And this intern did too, you know. It's great if you're a seamstress and you're working finicky things, but in that particular thing, it was just, you know. So we switch. We take this woman to theater. It's like 2 a.m. And because she had so much scarring from her previous operations, it was very complicated. What I knew to do at the time, I'd only ever seen one classic Caesar, right, and assisted in that classic Caesar. I'd never seen, you know, or I'd never assisted in a classic Caesar other than that one time. And so, you know, we're there now. You can't get into a lower segment. It's just not possible. And so the nurse, bless her heart, Sister Yvonne, she was like, Ntsanwisi, cut. We'll suture, you know. So we literally cut. We're cutting all these adhesions. We, you know, trying super hard to maintain like hemostasis because she could bleed. And you don't know what you're dealing with because she's unbooked. So you don't know if she has an HB of 12 coming in or an HB of 9. So, you know, you're already...
Massive risk factors.
100%.
Going in blind, yeah.
Yeah, so completely blind. So we do the C-section, deliver the baby. I'm praying to high heaven that all these sutures hold and that this woman is fine. And so afterwards, she's fine. We take her to high care though, for her to continue her monitoring in high care. The following morning, which was literally maybe an hour or 2 hours after we come out of theater, we have a ward round. And I'm lamenting to the consultant that, listen, oh, it was so rough, this, that, and the other thing. You know, this is what we had to do last night. You know, this doctor, your colleague, didn't come out, and she instructed not to open a second theater, and so we had to choose between this mom or this mom. And got in there, obviously difficult. This, that. It was just like, Ntsanwisi, why are you crying? Baby's born, mom is fine. Like, get over it. I was just like,
yeah.
And that was the day where I was just like, actually, I'm done. I'm actually, like, I'm finished. So I then, you know, I finished my conserve.
But what a traumatizing story.
Completely, because that other woman's baby died.
Sure. I mean, you had 2 lives in your hands, firstly.
Yeah.
You know, Yak, we don't realize these things, right? Because the stakes are not that high in dentistry. Like if you break a tooth in ComServe and you do a surgical extraction, the worst thing that can happen is the patient will go back with a root in their jaw or something. Right? But here now, 2 lives at stake.
Yeah.
Were you not shaken after this?
Completely shaken. I literally took sick leave.
Yeah.
After that, I took sick leave, and I was just like,
you're probably just functioning on adrenaline, right? That
completely
in that moment,
completely on adrenaline. Like there was nothing else. And I think it just was so shocking because I was always under the impression that we come into this to help people. You know what I mean? You're a little bit inconvenienced by the fact that you have to wake up in the middle of the night, but it's part of the, you know, it's part of the vocation.
Yes.
You know what I mean? It's not just a job.
But now your story is not unique. We've heard many people tell us. So why do you think that we are like this?
I couldn't tell you. And sometimes perhaps it's the Stanford prison trial. You get put where they split up the class into prisoners and prison wardens.
Yeah.
And they were classmates, but then the wardens turned against the... So perhaps people get put into these positions of power and they're just like, you must suffer like we suffered, or... I can't tell you.
What I'm hearing is, and the common thread in your stories it's always the negligence is coming from high above.
Yeah. Above. I think when you're young, you come in, you're bright-eyed, you're bushy-tailed. You're coming in from GSH where everything is working and life is fantastic. And your consultants and registrars are on site. You know what I mean? Whereas now you go somewhere else and they are 30 kilometers away or 40, 50 kilometers away. So that for me was a big thing. And the thing that touched me in those couple of years was the fact that when the people who sometimes were doing these things, their families were not coming to these hospitals. You know what I
skin
mean?
in the
They're
game
on
for them.
private.
Yeah.
There's no skin in the game for them, exactly. And when there was skin in the game, somebody from higher up would tell you to come bump this patient off so that this person could come and take over this bed or whatever the case may be. I just thought that needed to.
I have a theory. I just think that a lot of people get into healthcare for the wrong reasons. So they don't really care because it's a basic thing, right? The humanity. Like if you know that somebody might die if you don't come, how can you not bother? But there's so
Right.
many people that just don't bother.
Right.
You know, so it must be something about
It's
it. Like,
it will blow your mind. Yes, the things that actually happen.
like I can get, we've worked office jobs, right?
Yeah.
If you've got a deadline and then you're like, oh, you know what? I'll extend that deadline. That's fine. Nobody's going to die.
No one's going to die.
That's what Donald Dinny used to tell me. Nobody's going to die. Ash, don't worry.
That has been my thing since I stepped into a law firm. I was just like, guys, relax. No one's dying. Like, genuinely, I've seen
you've got
death.
that perspective. Yeah.
No one's dying. You know what I mean? You can put as many exclamation marks on your urgent email.
Yeah.
It's not going to make me jump.
Or copy as many.
Copy all the partners. It's not going to make me jump. Because worst case scenario, literally outside of like an urgent application to get a transfusion for a baby, it's just a bit of money.
Literally nobody's going to die.
No one's going to die.
So that moment of your superior not coming out, it's like, okay, I need a change. But what made you think of law? Where did the law come?
So I mean, it didn't come for a while. I was just like, something needs to change.
Right.
So then when I finished ComServe, I took a break until the money ran out. And so I had to go back and like work. And then
what was it like earning money? Because you probably didn't need it that much as a child. I don't know. What was your first paycheck? What did you do with your first paycheck? Can you remember?
I got my parents' gifts. Yeah, I got my parents' gifts. Then I don't remember what happened to the rest of it. But
what were you doing with your money?
Generally,
Shopping,
probably eating well.
Yeah. Were you investing or saving?
Gosh. I mean, I did buy a place, so at least I did that. I did get an investment property. That was but I spent a lot of time in Johannesburg because PLK is.
How far is it from?
About 300 km.
So you drive 3 hours? Or...
Yeah.
What were you doing in Joburg?
My sister lived here. My sister's been here forever. So I just come here, go out for dinner, go out and party. Right. I was young then. I had energy.
Yeah.
So yeah, no, I spent quite a bit of time in Johannesburg. And then, would head back on Sunday nights and get ready for Monday.
Sure.
So that's probably where my money went, petrol.
Yes.
And Johannesburg and partying.
Yeah.
Yeah.
Do you wish you'd done anything different with your money or no regrets?
Gosh. Yeah. I'm sure I could have done better things.
Yeah. But nobody was there to teach us, or tell us.
That is so true.
We're blaming other people.
Only time, but genuine facts. The only time when we got any communications from banks was when you were in final year, just before you graduated, and they come give you a fancy card and a huge line of credit. That's it.
The zebra, not the unicorn. This time, the zebra.
Literally the zebra. But I don't think we had the zebra back then.
That's what we call this episode, from unicorns to zebras. Go on. Yeah. No, it was the zebra. I'm pretty sure.
No, we had FNB come.
Okay. All right.
Yeah.
Yeah, I'm pretty sure Investec was not targeting newly qualified doctors.
I'm thinking of law firm, because when I was at Norton Rose, Investec came for us.
Yeah, but that was much later.
And the funny thing is, we were earning much less.
Hello.
Yeah.
That because you come out of med school and you're earning from the beginning so much more than your peers.
Yeah.
You know what I mean? At some point, it sort of levels out, and because now they're partners and we still just But when you're coming out, it's just.
You making money. You got money.
The first salary I made as a lawyer was less than the first salary I made as a doctor. And the difference was 10 years almost.
Okay, sure.
Yeah.
Yeah.
No,
I know.
So lawyers.
and people think, wearing fancy suits and nice.
Right, Ben Santon. No chance. That chance. But then I had to go back to work, and that's how I discovered casualty. And I actually thought, and I did that for a couple of years because I really enjoyed it. It's immediate, satisfaction. Like, people come in, they are severely injured. You reduce their shoulder, you splint the broken leg, you put in the ICD, you stitch them, you put in a catheter, and they're better immediately. So it was just so gratifying.
This was state as well.
Yeah,
Okay.
yeah.
Where also in
No. So I did a little bit in PLK, but a lot of my emergency experience was actually here in Johannesburg. It was fantastic. It really, really was. I actually even did my diploma in emergency medicine because I thought, okay, cool, we could do this.
Yeah. Were there lots of like violent crimes and all that stuff? Or
It's
not really?
Johannesburg.
Yeah.
Of course they are.
Yeah.
Wednesday afternoon gunshots. It's
On a Wednesday afternoon.
literally on a
Come
Wednesday
on,
afternoon.
They don't take time off.
Couldn't wait for
Ah,
the
no.
weekend.
Thursday, Friday, please.
Yeah.
So it was very exciting. I really enjoyed it, but at some point I just sat down with myself and I was like, I'm still in adult pajamas.
Yeah.
And I think that the itch, the injustices, for lack of a better word, still were going on. You know what I mean? And it was still just helping the end user. You know what I mean? Where there was so much more going on, that could, change the situation. And not just from a clinical practice perspective. You know what I mean? Not from all the other different angles, not from like social, not from this, but just from a clinical practice perspective where you can see that practice could just be so much better, not just for the clinicians. For the clinicians, because in turn, better doctors will help patients better.
Yes.
You know what I mean? And just efficiencies in the system as well. So that was it. I was just like, actually, there was this that I wanted to go do. So let's just go do it.
Which is?
Law.
Like, how does that come in? No, seriously. Like, law.
So
randomly.
In my mind, right? And I've always wanted to be able to help people, right? And like I was saying, that it just felt like the end user is getting helped. Yeah. And so going into law, what I wanted to do was to effect change on a bigger scale, right? And
because lawyers can do that. It's a common thing that I say. Like, clinicians will change one person's life
100%
at a time.
100%. Yeah.
But lawyers, engineers, scientists, they can change the world.
Yeah.
Yeah, policymakers as well.
100. But not even that. I mean, if you look at some of the cases that like say big cases, right? Those cases change practice in the sense of like how certain things will be done. Take just a random thing, euthanasia, for example. You know what I mean?
It sets precedent.
100%. It sets precedent. The law says you can or you can't. Abortion, same. Law says you can or you can't. You know what I mean? Doctors will be the people that implement whatever it is that the law has already said. So it really does, filter down to the patient. If that starting point is decent, it'll filter down, hopefully, well. Sometimes things get lost in the mix, but the idea is that you can touch more than just the one patient in front of you.
So who did you speak to? Who gave you this idea about
No one.
Just
no
Googled?
one. No one. I literally was just like...
There was no ChatGPT in those days.
There really wasn't, eh?
Yeah.
We would have done so much better in life.
And where did you apply?
Wits.
No, wait. We don't just... So you just... One day you say, I'm going to do law. And who do you tell?
I applied first.
Quietly. You just quietly applied.
Quietly applied. Then I told my parents. My mom was just like, no, what do you mean?
Why? Why?
Because her daughter wasn't going to be a doctor anymore. Because my mom comes from the time when, there's prestige in being a doctor.
Don't all our parents come.
Yeah. You know what I mean? Yeah. Now I'm just going to be a lawyer. Like, you throw a stone and you hit a lawyer. So I was like to my mom, I'm still going to be a doctor. Like, don't worry. Just think about it as me having specialized in law. When people are specializing in,
Your mom was smart. She knew, hey, don't do law.
Yeah, I should have listened.
Yeah. Like, my dad told me don't do it. when I was matric.
But I don't get you. It's not like you're relinquishing one degree for the other.
No,
You
that's
still
the
can
thing.
be both.
But
No, you can't.
in my mind, I think I still am, because, like I'm saying, it's like I just specialized in law. Because a doctor who's doing public health is no less a doctor just because they're not toting a stethoscope every day.
Yeah.
You know what I mean? I still do a lot of clinical related things, and more so now because now I've sort of moved into like the risk side of clinical practice. So still engaging a lot with doctors, nurses, etc., etc., etc. So yeah, I don't feel like I let one go. I'm just not risking catching TB every day.
Yeah.
Wait.
But wait, sorry. Can I ask? You said no, you can't. So you said no, you don't. But
Like
Can you
you're not practicing both, are you?
but can you practice both?
Naveen,
Technically,
Naveen
yes.
did, yeah. Naveen, remember we had Naveen Naidu on. He did both.
Yeah.
Pay attention in the
He
interview.
was in Australia, man.
No, in South Africa, he was doing both here.
Oh yeah, but that was back in the day. Now
No,
can you?
technically,
You can do it,
technically
yeah.
you can.
Okay.
Like
Yeah.
technically you can.
so why
but,
don't
like,
you?
Practically speaking.
Do you want to? I really enjoy sleeping at home and also not dodging catching TB every day.
And practically speaking, like you cannot give either one the attention it deserves if you're doing both.
It depends. So when I studied full time and I worked part time.
Yeah, I want to ask you about this because but wait, I want to pause there. Let's just go back to you. Break it to your mom. She has some sense in her to say, don't do it, don't do it.
She wasn't like, don't do it, don't do it. She was just like, my kid's not going to be a doctor anymore.
I can't go and tell the community, my daughter's a doctor. And your old man? What does he say?
My dad was like, she's paying for herself, man. Let her go do it. Like,
Yeah. Because you have to pay for yourself.
Yeah. She was like, no, you're paying for yourself.
So you quietly apply where? To UNISA?
No, I applied to Wits. No, I went on the edge.
Yeah. So what was the plan? To like not practice and do full time? What was the plan?
If I did it through UNISA, I don't think I'd be an attorney right now.
Why?
Because of what you said.
Yeah.
Because you don't, your attention and time will be so split, and medicine is demanding in the sense that, like, when you're there, you have to be there.
Yeah.
Which is why I say it's you can't be at 2 a.m. half asleep as a doctor. It doesn't work that way. You know what I mean? You can be half asleep drafting, but you can't be half asleep practicing medicine. And when I'm in something, I'm in it. So when I was a doctor, I really was in it. So if I was working full time, I would have given full time of myself to medicine, and then I would have never gotten a chance to study. Because come the weekend, you're working some weekends, you're tired, you've got weird hours. It just wouldn't have worked. So I was like, if I'm going to do it, I have to go full time. So that's what I did.
So what happens? You applied to Wits to get in, and then
I applied to Wits, got in.
Did they check if you made a mistake? Like,
no, they checked when I applied for my master's. They were like, no.
Are you sure you want to do this?
And then what's the prerequisites at that stage? They're still asking for matric.
I mean, anybody can get into law.
So apparently they asked for your matric because it's easier to fake degrees.
Yes.
Than it is to fake your matric certificate.
Umalusi. They got some security.
Apparently Umalusi is, So yes, they
That's how fake there's a fake doctor in Mpumalanga. I don't know if this is an urban legend or whatever, but there was this guy that, like, he was a doctor, and then one day when he had to produce for something, he produced his matric certificate.
Yeah.
That's when they found out that this guy had become a doctor based on some, I don't know.
Can you
Sounds
imagine?
like BS, but yeah. But anyway, no.
It's possible, hey?
So wait, so you applied to Wits, and what do? You stop practicing?
So I mean, while I was practicing, like I said, I did my diploma in emergency medicine.
Yeah.
I did the ACLSs, PALS, all of that. So
what's PALS? Pediatric?
Pediatric Advanced Life Support. Yeah. So that then allowed me to locum in private and to locum in government. So what I was doing is I was going to school Monday, Friday, and then
Monday to Friday.
Monday to Friday, yeah.
Shoo.
Monday to Friday, did school. Some afternoons I would assist in theatre, and then I would work weekends, and I'd work public holidays, and I would work school holidays.
Okay.
So that was like no life whatsoever for like 3 years. because what I would work enough to pay for my monthly bills.
Yes.
And then I would work like in the blocks, so in the school holidays, and I would pay off school fees from the school holiday work, mostly like in December. So like I would pay off whatever was needed to be paid off in the beginning of the year, whatever registration or whatever, make first payment by X, and then I would pay the remainder come the end of the year. So yeah, no, for 3 years, zero life.
I mean,
Nothing
very
but work
inquisitive
and
question,
study.
but what were your monthly bills like? Like what were your
So
responsibilities?
So it was literally just my medical aid, groceries, da 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 da.
Standard.
Yeah, the usual things.
No dependent. You didn't have any dependents or anything at
No,
that
my
stage.
dependent is very fresh.
Okay. Yeah.
Yeah, which is also another thing that I say to people, because I mean I waited very long to have a family, and I was like, I think God works how God works.
Yeah.
Everything happens when it's supposed to happen. Because if I'd had a husband and children much earlier, I'm not sure you could give up a doctor's salary and the effect that has on your household, to go be a lawyer with an uncertainty in the future. You know what I mean? So then, I mean, if we're eating bread and eggs, we're eating bread and eggs.
This is why I asked the question. I'm not just like, I am inquisitive, but I want to know, like, how do you? It's difficult, right? And people need to know how it works.
Like I said, my first salary as a lawyer was less than my first salary as a doctor.
How was law
as
school?
an intern, even.
Yeah, that I can believe. That's
I didn't. I went to law school single-minded focus. So I don't know.
Yeah.
You know what I mean? I didn't go to making friends for me was a fortunate happenstance.
Yeah.
You know what I mean? I wasn't there for any of that. Like I would get there for class. I would leave once class was done. I didn't really socialize. I would socialize if there was a lunch break between my classes. But short of that...
And nobody knew there was a doctor in them.
They found out.
How did they find out?
I don't remember. Maybe it's because I wore scrubs sometimes.
Okay.
Because I would have to literally...
Like Batman vibes.
You know what I mean?
She's going to a night job.
Because I would assist a surgeon in Mill Park. So sometimes I would literally pop out, pop back in, or whatever the case may be.
You've got to do some doctoring and then
just a little quick,
medicine, and then come back and study.
Or like have to go start a shift like on a Friday, like at 5. So I'd have to just...
And everybody was much younger than you in
a lot younger.
Law school. Yeah.
A lot of people were younger. Some of them weren't. Some people also had previous careers, but a lot of people were younger.
So how long is that? 4 years?
So Wits had a post-grad program where if you have a postgraduate degree in something, you then do 3 years because you don't have to take any other subjects except for law subjects. Okay. So that's the stream that I went into.
Hey, maybe I should have done that because I did 4 years.
No.
Straight. And then once you qualify, what happens?
Then I got articles.
But who tells you must now apply? When did you apply for articles?
Second year.
In second year of law?
I mean, I was fortunate. My sister was already a lawyer.
Oh, so she told you what to do.
Yeah.
You see,
yeah.
And then when you applied for articles, did you have this funny story like I did where I applied for articles?
Yeah.
And then the HR lady calls me and she's like, I just want to make sure you haven't made a mistake. Because I can see here you're a dentist and you want to do articles. I was like, no, it's deliberate.
That's right.
Yeah.
No, so where I did articles at Adams and Adams.
Yeah, why there?
I didn't want to be in Johannesburg.
All right.
Where's that?
In Pretoria. I didn't want to be in the same... No, just because my sister was here.
Yeah.
You know what I mean? And I thought it was only fair to give her space to flourish. You know what I mean? People still look at us and go, are you? I'm like, yes, I am her sister. You know what I mean? So I wanted her to be her own person. You know, I didn't want to be on some, oh shit, your sister's here, or that kind of thing. So I went to...
You went far. I mean, you could have just moved down the road or something. Hello.
Sandton is small.
It was change of trade. You took it
I took it to a different 50-kilometer radius.
Not to the UK. Then, Adams.
So Adams had a very cool recruiting program. They had a thing called, what was it called? Something games. Recruitment games. And you go there for a weekend. And they put you up at the hotel just opposite Adams. And it's very interactive. So it isn't just one interview with a partner or, the team or whatever. You play all sorts of games. Like there's like a partner speed dating where, you'll sit with a partner, they'll ask you questions, you'll answer quickly, all sorts of things. And I was like, okay, this place is pretty cool. The questions I got asked though wasn't that I got the usual, articles. It's going to be different, da 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 da. But I also got asked, are you going to want to start a family soon? Because I was a lot older than.
Oh, they asked you that question?
They did. They
Lawyers
really
should know
did.
better. Come
You
on.
know what I'm saying?
Yeah.
You would think.
But it happens.
It happens. And shame. I mean, it's because I was a lot older than the 21-year-olds.
Your contemporary.
Wait, sorry,
Yeah.
what's the inference of asking that question?
You
As
shouldn't ask that kind. I mean, that's like,
That's
it's what do you call it? Discrimination 101. I don't know.
it. Kind of is
Yeah.
because if I had said yes, would that have jeopardized my
implication on the
100% with that?
Okay.
Get it?
So that kind of thing. And also,
Yak is making mental notes what not to ask potential employees now. See, you can see Yak.
Or myself if I have to go for an interview.
yeah, you're just
Am
like,
I planning to
no.
start
You
a
need to
family?
retire that question, please, Yak. Please retire that question when you're recruiting.
So like questions like that came up.
What was your plan though? Like, were you just going to, I just want to be a lawyer? Or did you think patents or this or that or the other?
So I actually wanted to do med-mal.
Okay.
And I was very fortunate in that all my training has been largely med-mal.
So you knew from day one
Yeah.
to be a med-mal
And
lawyer.
when they tried to like switch me up, I was like, I'm
Med-mal, medical malpractice.
Yeah, I
Yes.
was going to actually tell him.
Not like psychiatry, like
no.
mal.
Yeah, that's
malpractice.
Afrikaans, yeah. Yeah.
So when they tried to switch me up into different rotations, I was like, because Adams is obviously known for IP,
Yes.
intellectual property
That's
work.
why I mentioned the patent thing.
Yeah.
Yeah.
So I was like, I'm not 21. I'm not wet behind the ears. I have an entire career behind me. I don't need to still find myself. You know what I mean? So it's you just let me do this, which is what I came to do, and let's all be happy.
And they said yes.
And they said yes.
Good on them. That's what they did to Dr. Moslamanyane. I had him on the show
Yeah.
recently. They didn't even make him rotate. It's like,
Yeah.
you know what, we know what
100%.
you're here for. So that's cool. They accommodated that.
Yeah.
What do you do what do you do
So there we.
on the dark side?
Yeah, that was on the dark side. But
Explain
I
for
saw the
Yak.
light.
Explain.
Yeah,
Plaintiff's work.
Okay.
Yeah.
Like representing the patient.
Yeah.
The patients.
I get it. The dark
But I
side.
think that I still, dark as it is sometimes, which is why I left, but I think it's important to have the right people on the dark side, because
And maybe it's not the dark side. Maybe
it isn't.
Yeah.
It's you know what, when people are hard done by, they do deserve appropriate compensation for whatever it is that happened to them.
Yeah.
Number one. Number two, the reason why I think that the reason why a part of me would entertain plaintiff's work is because of the knock-on effect it has on doctors. Because I've seen way too many cases where plaintiffs' attorneys have used a shotgun approach, where just because you walked past the patient at some point,
breathed on it.
you know what I mean? You're coming into this matter. And it's because they don't know who it is that they're supposed to be suing. They don't want to find themselves, 3 years into litigation only to be on some, we actually got the wrong person. We should have gotten this person. And where somebody like me comes in is to say, but this guy actually did nothing. This guy's the guy you're looking for. So don't bother with this particular person.
Isn't this why, like, some defense lawyers, when they see that the patient is represented by people that know what they're doing, you actually get a bit of relief. Like, okay,
You do.
we're dealing with professionals.
You do, because when I came onto the other side, you know what I mean? You would get a summons and it was just like, this makes sense. You know what I mean? This makes sense. The claim makes sense. The allegations make sense. The money that is being sued for also makes sense. And then you just like, we can have a discussion early on. You can have a discussion early on to be on something. Actually, this is where we are. Your case is this, our case is this. Let's talk.
Yes.
Where are we? Whereas if I see, I don't know,
Inexperienced, some random, like a...
and the thing is, you can tell. It doesn't even have to do with the name of the law firm, right? If I see a particulars, that is for a complication that resulted in some bowel perforation or something, right? And this person had a colostomy for 3 months and they're claiming 10 million rand. I already know we're in trouble. I already know we don't know, this person doesn't know what they actually are dealing with. Whereas if somebody comes to me with that kind of claim and says, I'm claiming 1.2, I'm like, maybe we talking something here. And I think a lot of it might have happened because of things happening with RAF and people moving over into the med-mal space.
Yeah.
You
got to start somewhere, right? And they figure it out as they go.
But
so what was it like starting for you? Like leave now, completely different world.
Yeah.
No longer in pajamas, right?
Yeah. No, I got to wear high heels.
Yeah.
And I wore high heels like with dedication. You know what I mean? I was like, I wore tackies for the last God knows how many years. I am not wearing flats at all. And then COVID hit. So it was really, I enjoyed it. But I remember one night it was like 2 a.m. and we had a trial the following day and bundles needed to be prepared and I was at the printer and printers never work.
When you need them.
No.
Yeah. We had a sign at one of our printers to say, don't let this printer know you're in a rush because then it stops working.
Literally. Yeah. And this thing was just not working. And I just remember thinking to myself, my dad did not pay for 6 years of medical school for me to be fixing a printer.
Yeah. Yeah. Imagine.
Like,
humble yourself. Eh?
You're
carrying files.
But I think when I went into it, I actually understood because when my sister was a candidate, we all lived together, right? So like I just saw this poor girl suffer and she would come back and she would look so tired and just finished. And I was like, but you're sitting at a desk the whole day. I'm the one walking around casualty doing this, that and the other thing. But she just looked so tired and she had like files for days and doing this and pagination and God knows what else, right? So I kind of saw like a foreshadowing of what was going to come. So I went in prepared, but I also knew that as a lawyer, I didn't know anything. I might know something in medicine, but as a lawyer, I'm as good as being 21.
Yeah.
You know what I mean? So that's the attitude that I went in with. So it sucked.
How did they treat you? How did your colleagues treat you? Were they good to you?
Yeah. I think I was very fortunate in that. I think.
And you went there with an open mind.
And I speak so well.
But it's Pretoria. But your Afrikaans is good also.
Yeah, I can Afrikaans praat, yeah.
Okay.
So it wasn't a problem at all. So no shame. Bless.
We came across each other once in a matter.
Yes, when I was at Adams. That was the first time we met.
Yes.
Yeah.
Opposite sides.
Yes. Yeah. Good side, other side.
I don't even think I was in the...
You were.
Wasn't I at ENS at that time?
No, you were still at Norton Rose.
Oh, okay.
Yeah.
All right.
So no.
And then what happens after Adams?
So I left Adams, and I came to Sandton.
Yeah. You decided finally your sisters had enough space now. You can move back.
Yeah, no, she'd gone back to Cape Town at that point, so she was fine.
So Sandton was.
It was time. It was time to get into the shiny.
Yeah.
The shiny buildings of Sandton.
Webowenzel.
Yeah.
And that's where you came to Maria.
Yeah.
And
so
defense lawyer now.
Defense lawyer, big shot defense lawyer, no less at Webowenzel.
Yeah, that's. I mean, Webowenzel,
I know.
It's like big. It's like peak law.
Yeah,
like attorney.
Top 5.
Yeah,
top 5.
I think they're the top.
Probably the top now. Yeah. Everybody wants to go there.
Yeah,
these law firms have their phases, right?
Where they do.
Everybody wants to go to one, and then after a few years,
everyone wants to go somewhere else, etc. Yeah,
and people move around.
But where are they all based?
This is why I was saying it's so tiny. Literally, they're in Sandton,
that's
around the mall.
What are you saying?
Like where are they all? Where are they from?
Literally around the mall.
No, I mean like Webowenzel. Like these were partners sitting in the UK, or where's the firm?
You should know.
No, so Weber's is local. But it does have a link. I'm not sure. I don't know if it's still ongoing to Linklaters in London.
Yeah, I see on the building.
So they have a relationship with Linklaters. But it's a local firm.
But Weber's is the place everybody wants to be there now.
And I get it.
Yeah.
I get it.
ENS.
Were you not there?
No.
No, you were at Norton.
I was at Norton Rose, and then I went to ENS. Then I went back to Norton Rose. But when I worked...
People go back to Norton Rose. People love going back to Norton Rose.
I go back home. But when when I worked for Maria, she was at Norton Rose.
Yeah.
And
Yeah.
so what was it like changing sides now, becoming a defense lawyer?
I think I'm better suited to defense law.
Why?
Thank you.
Why?
We appreciate
No,
you.
but
Yeah,
why?
I think I think my conviction is stronger to defend doctors.
Okay. Because you are one. If you're part of the fraternity.
Yeah, I think, you know what I mean? I empathize with things going wrong. And that's why when things go wrong, even now, I'll be the first person to say, quit this, settle, let's call it a day and move on. Just because if you're supposed to, you should. Don't drag it on.
I mean, you
Yeah.
know what it's like.
I'm gonna also step in here because if I think for the viewers, and they're all not attorneys, I think, but what was my question? It's not criminal, right? This is not criminal
No.
matters. This is so it's civil. So it goes to like arbitration and things like that. But if I can ask, you said earlier on that you do feel that patients need to be represented and whatnot, and that's why you were on the dark side. But is that not the job of the HPCSA?
No. The HPCSA, and I think people get this wrong quite often. The HPCSA is the regulatory body for health professionals. Because as a professional, you're allowed to be self-regulating, right? So in as much as they're an oversight body to make sure that doctors practice within the guidelines, with ethically, you know what I mean? But they're not there necessarily for the patients.
Okay. So
does that
patients
make
still they have to get their own representation.
So if a patient's matter goes to the HPCSA and it goes to inquiry, right? The pro forma complainant, who is an attorney within the HPCSA, takes over that matter, and is then the person that represents the complainant in the matter. But the fact remains is that what the HPCSA, please, whenever you get somebody from, I would love to be here.
Ask them to change their name.
Go on.
Pardon? No, just when you guys get somebody from the HPCSA, please invite me.
Do
you have any contacts there?
I mean, I know people.
Yeah, because I mean, I would want to get some of the doctors from there, especially.
Yeah, because it's what you're saying is what is happening practically. But what the HPCSA is supposed to be doing is they're supposed to be making sure that doctors practice right. They're supposed to be making sure that the profession isn't going into disrepute, right? They're not supposed to be holding a stick and whipping the doctors. You know what I mean?
You're still registered with them, right?
Yeah.
Yeah. So be careful what you're saying.
No, it's facts.
I'm joking.
This is what I'm saying. I want to be here when somebody comes here.
She's a lawyer. You see?
Yeah.
That's a lawyer.
I'm still not getting the answer though.
What?
My question is a patient who lays a complaint with the HPCSA against the doctor, do they have to get private legal representation?
No, because the pro forma complainant is the person that represents the complainant. They don't need to get private representation. It's free for the patient.
Okay.
It's not free for the doctor.
Why do you ask?
But it's free for the patient.
Why are you asking?
Because earlier you said that, you're working for the dark side. You said that it's you enjoy, so patients deserve
compensation. But the HPCSA doesn't give compensation. That's another thing that you must keep in mind.
Yes, of course, yeah.
They just there,
to uphold professional standards.
100%. Yeah.
And lots of patients come to the HPCSA thinking that
they're going to get compensation.
Yeah, HPCSA is going to order the doctor to pay them whatever.
No, the doctor might get ordered to pay a fine, but
not to the patient. Yeah.
Where does that money go?
To the council.
When you get the answer to that, please let me know as well.
To the council, yeah.
And then what do they do with the money?
Well, they use it for their processes, the internal. Yeah, they're not.
Let's get that guy on.
From what I understand, they're not using it to for bonuses and things.
No,
I've asked this question.
No,
and that's the answer.
They aren't using it for bonus.
Yeah.
Are you registered with them?
That's right. You'll get a investigation here. An anonymous. Yeah. So you registered with the LPC and the HPCSA.
Yeah.
At least we don't have to pay as a
non-practicing.
Yeah. What's LPC?
We don't have to pay.
Law Practice Council.
Legal Practice Council. Yeah.
We don't pay as non-practicing attorneys.
No.
But we still pay.
You
paid your $3,000.
My dear. 3,600 and what's it? 40 rand.
So, but you no longer at Web Wenzel. So what happened? Like, did you get tired of defending the doctors?
No, not at all. Not at all. I actually really enjoyed my time at Webbers. I the fast-paced nature of it, it was a great time.
Which is Sandton or Pretoria?
Sandton.
Yeah.
Well, Sandton.
We had a nice view.
Oh,
There's a
fantastic
Cape
view.
Town office as well, isn't
Where-
there?
There is a
yeah.
Cape Town office, and the Cape Town office is right there at the foreshore. So
Yeah,
it's also
yeah,
quite
I've
cool.
seen it.
Um,
And Maria is lovely. Hey?
yeah, Maria, Sandra, they're all
yeah,
like
Sandra's there, yeah.
fantastic. Yeah. No, I really enjoyed my time there. The thing about the billable hour is if you're awake, you can bill.
Mm.
That's, whether it be 2 p.m., 2 a.m., it doesn't matter. If you're awake, you can bill. In fact, you should be awake to bill. And I wanted a family, and because the tricky thing is that you either do it at 2 points of your life, right? You either start your family when you're really young so that you can then get that out of the way and then climb the corporate ladder, because it requires time and attention to actually do all that climbing. Or you do it once you're there and you're a partner and, now you own your own time and, you can do whatever you want with your time. But because I started my career late, my legal career late, I was in my late 30s, fighting the billables. And I didn't want to find myself in a situation where, I'm now in my 40s and I'm thinking, oh man, maybe I should, start a family. And then I've got all these medical things that are against me. So the situation then became, am I gonna be in practice and have a career that's not going as fast as I would like it to, which would frustrate me because I would not be able to reach the billables that I would need to be reaching to get to where I need to get to fast enough. Because I really enjoy, I really enjoy being a wife and I really enjoy being a mom and, being able to spend time with my family. It's really important to me. So that was the thinking then. But also it just also came back to the idea that, sometimes you are only just helping one clinician. We were helping only one patient, but now we're only helping one clinician. And so I just wanted to then grow a little bit more. So those two things, they weighed heavily on me, and that's why I left practice. But I have a lot of, I think I have a lot of practice still in me.
Okay.
You know what I mean?
Yeah.
I whether or not I'll ever go back, I don't know. But I still have a lot of practice because I enjoy working.
Mm.
You know what I mean? I actually enjoy putting time in. So maybe when the kids are grown.
Where did you go next?
So I went to NatMed.
Right.
Yeah.
Are you still there?
No.
Okay. What were you doing at NatMed?
Almost came to MPS.
Yeah.
So what I was doing at NatMed was I was there like in-house attorney.
What is NatMed?
So it's a brokerage for an insurance brokerage for doctors, but specifically specialists and even more specifically obs and gynae. So yeah, so that's what I was doing. So
What you up to now?
so now I started my own consultancy.
Yeah.
In the medico-legal space, but it's more risk related, so it's risk mitigation, risk identification for doctors, for facilities, and still doing some work for insurance houses as
cool.
well.
No dentists.
No, I just haven't had dentists come to me.
Okay.
It's not that I,
Can I have a job?
listen, I'm not hiring.
I'll consult for free.
Do you want to have a family?
Yeah, I did the latter of what you said.
See,
Establish a career and then
then
a family.
have it done.
So these doctors and these facilities come to you and say to Nina, "Can you? What do they do?"
So what happens?
Dumb it down for me.
What I've realized, right, is that it sort of is like the money thing, right? I think doctors go into practice to just doctor. Everything else is noise, And I don't know what it was like for you going into law, but for me, I struggled to. Law is very, what's the word? Like, it was dense, like not knowledge dense, but reading dense.
Yeah.
You know what I mean? So you actually have to sit down and read. Whereas as a doctor, you were more hands-on, you were more in there. So I struggled with the reading part of it. And
It's a lot of reading.
It's a lot of
You're
reading.
always reading.
Always.
I remember when he used to study, I was like, oh, I can never do
Literally.
Not even
this.
studying. When I was working, I would hardly ever check Twitter or anything because I've read so much.
You don't want to
Don't wanna
read
read
anymore. Exactly. So, like as doctors, I think there's a lot of stuff that doctors miss because they're so busy doctoring. You know what I mean? And so at the end of the day, doctors don't know what it is that they don't know.
Yes.
And doctors aren't in a lot of ways empowered to protect themselves.
Yes. A perfect example is Yak. He's registered with the HPCSA, but he doesn't even know what they actually do.
Exactly. So now you get called into the HPCSA and you're shivering because you don't realize that you actually have rights and recourse
not
even
answerable to them.
at the HPCSA. You know what I mean? Or say, for example, when a doctor gets a complaint from a patient that is a complaint that should have, or a complaint that should have gone to the HPCSA, but the complaint was actually directed to the OHCS. You know what I mean? You can literally say, I'm not answerable to you.
Yeah. Yak has no idea what the OHCA.
I'm the Oral Hygiene Council.
OSH.
Okay.
We call it OSH. But
oral hygiene.
But how is it? It seems like a tough gig. What you're doing now. Like, how do you get yourself out there, your name out there?
It's for me. So fortunately, I think there was a lot of exposure that I just had over time, and it's also it's again, it's a unique skill set that I have. So there has been a lot of word of mouth that happens. I have a lot of doctor friends and ex-colleagues, etc., that know what it is that I'm doing, and it's just a translation, I guess, of law where people just will talk.
It's also a risk. It's like you're doing your own business now. You're self-employed, right?
I am.
So
I am.
how's that?
That's a whole another.
You've never done this before in your life. You've never been self-employed.
The thing is, I think when I was locuming, it was the same as being self-employed.
Okay.
Because if I didn't work, there was no money coming in, and so if I didn't feel like working, I must then,
But I feel like that's slightly different because at least when you're locuming, you know that there's work and you're going to go there and
there's definitely work.
Yeah.
There's a lot of work to be done because even if you take, for example, your facilities, right? The relationship between the facilities and their clinicians, you take a look at, say, the confirmation of consent. You know what I mean? Sometimes you find that the nurses are then told, no, this is the consent, the patient must sign it. No, that's not the consent. The consent is what your doctor and you as the patient discuss. So those kinds of things. I'm saying that the facilities won't be aware of that kind of thing.
They won't be aware, right? So
Yeah.
they won't know that they actually need you.
And that's where I come in to be on some, this is where your shortfalls are. So there's a lot of presentation, there's a lot of pitching, there's a lot of, actually going to these people and speaking to these people to be on some, this is what's happening. These are your risks, and this is how we can mitigate these risks.
Educate them.
100%. To show them what it is that they don't know.
That's why I feel like it's different to locuming, because as a locum, you rock
in
up
that
this
sense,
work.
yeah.
Here you've got to actually explain to them why
you need
they need you.
Yeah.
And how's that
because
going?
it's so much more. Again, it's prevention.
Scary. Like, we're not scared that you're just going to be sitting and.
Nah, man, God's always loved me when it comes to my career.
Right.
Like, I've always somehow.
And where do you get this? I mean, it's a risk. You're starting your own business.
It is a risk, but you know what they say? If you build a better mousetrap than your neighbor, the world will beat a path to your door.
Okay.
So that's the idea.
That's what I say.
The idea is to build a better mousetrap. It is, and I think. I honestly, it just every time like doctors, are stuck in these things. You get two kinds. You get the kind that is just like, it's whatever, right? Then you get the kind that will literally consider stopping practice. You know what I mean? And I want to be there for that guy that is considering leaving practice because of one HPCSA baseless complaint.
Yeah.
Because it's so stressful. Like, because you're thinking, my career, you don't realize that, the complaint must go through a prelim phase. You write a response. There's so many steps, before it comes to finality. It might sometimes take forever, for this thing to reach finality.
And the scary thing is also, it's not just the career that people contemplate ending. Some of them get suicidal.
Literally.
Yeah.
Literally. It's so sad because no one, at least not in my experience, goes into medicine to be on some, today's the day that I'm gonna, maim someone.
Yeah.
And the same when it comes to being sued. A lot of doctors don't realize what actually goes into, having a successful lawsuit from the plaintiff's perspective. It's not that easy. So, yeah.
I want to ask a question.
Sure.
Yeah. This
Please do.
stage. Yeah.
Please do.
It's also like it's also an opinion of mine that I've shared with other colleagues. I don't even know. Maybe Yash is going to have to cut this segment out. We'll see what happens. But it's so unfortunate that there's certain private law firms, for example, I won't mention names, but one sounds like...
No, don't even do the sounds like, yeah, please.
But they
I don't want to do editing. I don't want to edit at all.
Okay. They actively tout for patients to sue practitioners.
Yeah.
To the point where they actually waiver fees and stuff, and only on, if they win the case, then they take...
That's a normal thing.
So that's a normal thing.
Yeah.
But that's not my point. My point is they subject the practitioner to, as you were saying, there's such like suicidal thoughts, and it's a very big psychological bearing on the practitioner.
Yeah.
But the practitioner doesn't have any rights. They have to be on the defensive all the time. And it's so unfortunate. Okay, look, I'm not speaking on behalf of like all practitioners, but someone...
But we've heard this many times from practitioners.
Yeah,
Go on,
but someone that has been maybe unfairly accused of doing something and it's proven incorrect, why does the practitioner not then have recourse to claim against the patient?
So, gosh, I mean, if that, where do I begin with this answer? So when it comes to the touting, a lot of touting happens. A lot of underhanded dealings happen between law firms, hospitals, nurses in some instances, where files disappear. Next thing you know, the government's getting sued. There's a lot of weird things that can happen in the background. But the bit about the fees, that's normal, because that's just taking a matter on risk, taking it on contingency, that, if you don't win, you then don't claim a fee.
Yeah.
And if you do and you claim X amount or whatever is lesser, there's a whole law around that. So that's actually legal and that's allowed. But if...
Yeah, that was just a prelude to my question.
Yeah.
Because I
No,
found out about that.
The counter suing the patient bit, I don't think that's not possible, right? In the sense that, like, you must, at least that's not how I would do it, right? The way I would do it is that if you know that your case is good, you're going to have to defend it because somebody sued you, and you can't stop somebody from suing you, right? People have the right to access the courts, and they will exercise that right however they see fit. So you can't stop somebody. But if you actually have a good case, which is why I think it's important to empower and educate doctors so that they do have good cases, so that when this kind of stuff does happen, they can actually stand, they stand on business, and be on some, no, this and this and this and this was done, this happened, etc. And then your case is as defensible, as you can put down on paper.
Can I ask?
That's not my question.
I want to ask, what would you? Let's just put you in that position. Right? The patient sues you now.
Yeah.
You're very upset that this patient has sued you.
Yeah.
So what do you want to sue them back for?
All the time that I have vested
General
in
damages.
defending myself, the psychological damage of
Legal
me wanting to quit, because I'm very sensitive. If someone has to speak badly to me as a patient, I would even consider quitting them. They wouldn't even have to sue me. But it's to the extent where I would actually want that person to know that was not right, like what you did.
So,
and especially the attorneys that defend them, that are touting them to sue unfairly.
So that's where I was going with this, to say that, I mean, for what you're bringing up is a whole different thing, but the second bit, but where I was going with this is this: if your case is strong and your case is defendable, right? I think that you can then put the attorneys on risk to say, I have told you that your client has no case. And if you proceed beyond this point, this is what's going to happen. We're going to want the legal costs from you. And if the case is really that frivolous, you're going to want the legal costs directly from the attorney.
Oh,
Because usually the patients are people of straw, so to speak. They're people who
what does that mean?
they're people who don't have the money to pay whatever it is that you would be suing for. So you could come, and it's still going to cost you to sue them, by the way. It's not that your suing is going to be free. And
No, of course.
And sometimes it's going to have to come out of your pocket because your insurance is not going to be there to back you to then go and institute legal action against somebody else. So if you know your case is good, what I would do is just then go have the attorneys tell the other attorneys that beyond this point, anything that gets incurred will be for your pocket should the judge find in our favor.
Yeah.
And if they don't have a case and they know they don't have a case, that I feel like that should scare them off enough.
Nina, I want to ask you something because you've been on both sides, right? Now, I know a lot of clinicians because I deal with, I've always been on the defense side when it comes to the healthcare workers. A lot of clinicians think that patients just want to sue because they want to make their lives difficult, the doctor's life difficult, or they want money, because they're greedy or whatever. There's that perception sometimes. In your experience, is that actually what happens? Like, do patients just want to sue because they want money? Or?
No.
Are you asking for the majority of the time?
Yes.
No. Some like often, no. Because just think about it, Yash. You go into hospital, you want to go, you're going in, you've had a normal pregnancy, you are expecting to have a normal baby, right? Lo and behold, something happens. And then this child now comes out with cerebral palsy, right? Now, you are now faced with a life where your kid is never going to grow up. They're never going to go to school, at least not mainstream. They need operations for their hips. They need to get their teeth taken out. There's so much. Your house might not be suitable. There's so much that actually goes into it. We live in a society that I think is very forgiving, in quotations, because a lot of people will be on some, I guess it's just this is my lot.
Yeah.
And then they won't do anything about it. But often people will try cope. And then they will realize that I can't. My means aren't enough, and then they will have heard something somewhere and then they will, institute action.
They're looking for a fair outcome.
And then the lawyers come in and, often skew the situation, There's that. The second thing that I've come across a lot is that patients just want answers. Patients want answers. Patients want accountability. You know what I mean? The money can be a secondary thing, but people actually want to know, how did I end up with, a colostomy when I went in for a hysterectomy? Yeah. Because no one. The thing about it is that I think, this is my theory, I think the reason specialists get sued is because they don't have the time to build relationships with their patients.
I agree.
I've hardly ever come across a GP getting sued. GP will sit with you, will explain even GPs that are delivering babies. You know what I mean? They will sit with you, they will explain, you've delivered all 5 of their kids, they know your grandmother, they've known you since you were 4. They have a relationship. A specialist comes in and out of your life as and when you need them.
Yeah.
So, and they also just, I don't know what gets lost in registrarship when it comes to, human touch, but something happens there, because they also just don't, bedside manner can sometimes be lacking. Some are great, right? But sometimes that bedside manner and relationship, human to human, can be lacking. So they are more exposed to being sued, and perhaps it's just not being able to explain things to patients in a way that they will understand. And
also the system kind of pushes them in that direction, right? Because I had an op in private. I saw my surgeon for like a few seconds, and then he was gone to another patient.
Yeah.
The system just like enables this lack of connection, right?
100%.
But going back to the point that we're talking to Yak about is that I feel like in your experience, and it's also my experience, that patients are not just suing because they want money or they want to irritate you,
Yeah, no, but my point was, if a case is disproved beyond reasonable doubt, right, why is it that the doctor is not compensated for the amount of stress and trauma and...
How do you quantify that?
Well,
I mean,
you guys
you can.
quantify it. Yeah, exactly.
You can. It's
You knew
quantifiable.
3 million
How do you
a
quantify the
case.
stress you've gone through defending a case? And you're
Not me. That's the
Well-
attorney's responsibility.
Well,
That-
you'd have to show that you actually went through a psychological break, so they call it, right? The fact
Or
that
defamation, for example.
defamation you can do easy.
Hmm.
You know what I mean? I mean, that's a whole different area of law. That's not not medmal, but it wouldn't be. Some people would need to sue for defamation, but you're starting something from the beginning. It's not linked to that initial case.
So what you're saying is anybody that gets sued and proves that they were not in the wrong,
Yes.
must then be able to counter sue and say you shouldn't have exercised your right, not law, to sue me.
Not shouldn't have, but they should have used a more of a precautionary measure to
But that's where your
gather
attorneys
the
come in.
information. Exactly.
And
And that's where the
mediation?
toting.
Is mediation going to happen?
Well, I mean, here in Gauteng, you have to mediate before you get into court, right?
Okay.
So there is room for mediation, but people are very circumspect when it comes to mediation because now you say too much or you say too little or whatever, you know.
I don't trust the mediator. Or the
yeah,
citizen.
or you don't. I mean, you also can't.
And then who's a mediator?
You can. I mean, I did mediation, so you know what I mean. You can have mediators left, right, and center, but the question becomes how much you're going to disclose at mediation to try get an outcome, you know, that won't jeopardize your case should mediation fail and you still have to go to court anyway. You know, that's the tricky balance that needs to be struck.
So dispute resolution is difficult.
It is.
And that's why there's specialists in it.
Yeah. But I mean, I wouldn't, if I had to like counter sue, if someone sued me,
Yeah.
I wouldn't sue them for money. I'd be like, right, if you lose, if I sue you successfully, you're going to have to pay like a charity of my choosing or like a puppy
still money.
or like a dolphin
Even
You're
if it
center.
so
goes-
altruistic, yeah. Wow.
Even if it goes to,
But it's
you
a
know,
lesson.
the
It's a lesson. Yeah.
SPCSA. I think the thing about it, right?
No, not HPCSA, SPCSA.
No, SPCSA.
Yeah.
Yeah, my bad.
Yeah.
The dog.
The
one.
thing about it is that I honestly think that, you know, litigation is a case of elephants fighting in the grass suffering because the lawyers will be at each other. They'll be discussing legalese and the patient half the time doesn't know what is plotting. They're just waiting for the payday. You know what I mean? The doctor also doesn't know what is plotting. They're just stressed, you know, waiting for this outcome. Am I going to get called to court? Am I, you know, do I have to now sit in court for the duration of this trial and now I can't see patients, which means I'm not getting money in or, you know, you name it. And if the lawyers would just really be forthcoming to each other and be on time, you have a case, you don't have a case, call it a day. And I think that's where problems start. I think, and I say this often, that I think it's the problem with medicine is lawyers. Because the lawyers are coming in and they're just stirring the pot and, you know.
Yeah. I mean, I honestly believe that. I genuinely think like your guys' industry probably needs to be more regulated as much as we are. We were talking about touting the other day in like our family group. If medical practitioners are subject to regulations with touting, why isn't the law fraternity? Why is it that a firm can come and say, has your doctor or dentist done something negligent? Are you not aware? Come to us. We'll represent you only if you win. Then we will.
I think that's advertising.
Yeah.
But yeah.
Yeah.
But I love the elephant and grass and you know, proverb or whatever you call it, because at the end of the day, the lawyers are fighting. The patient's not getting the answers that they wanted anyway.
No.
And they think that if they win in, you know, something in court, it's gonna make life better, but it actually doesn't, right?
It doesn't.
And nobody really wins besides the lawyers.
Yeah.
So there must be.
Well, I guess up until the claim is valid and the doctor was negligent, and then there's action taken against the doctor. So he's not
Well, the
practicing.
doctor will pay. I mean, the doctor's insurer
The
or whatever will
insurer,
pay.
yeah.
And then the patient gets the money, and
Oh, we're talking not. This is not criminal now.
it's never criminal.
Yeah.
It's almost never criminal.
Well, it's hardly.
Yeah. These are all civil matters we're talking about where the patient is suing for
Yeah,
money.
hardly.
They just wanted answers. If
They
it
literally,
could,
it's often enough they really just want answers. And
if the doctor met with the patient like right at the beginning before feeling the need to involve an attorney. And the doctor could just have like a protected discussion and open and honest.
Is that what your guys' opinion is? Like, how can you guys represent doctors and dentists? What's the best way to like mitigate those factors from a doctor being sued?
Oh, it boils down to one
Give
word
us
for me,
advice.
communication.
100%.
Yeah.
100%. But I think that the problem is that once patients are aggrieved and they actually complain, I think that the doctor is sort of caught off guard.
Back foot, yeah.
And is scared of what they can or can't say because they don't know, is this going to get me into more trouble? Or, is this going to get me out of trouble? Does my insurance allow me to speak?
Yes.
Does my insurance not allow me to speak? There's a lot of, fear. And I think because the society has become so much more litigious, that fear is very palpable. You know what I mean? Slightest complaint, slightest complication. Not every complication is negligent. You know what I mean? And I think a lot of patients don't realize that, and a lot of lawyers don't realize that.
In some countries, like there's a law which protects an apology.
Yeah.
Yeah.
What do you mean?
If you've messed up as a clinician and you go and say sorry,
it's admission of guilt.
No, it's not. I mean, there's some laws that protect.
Yeah.
So, meaning if you say sorry, that's fine. Then.
Yes,
okay.
No, if you say sorry, it's not. You're not going to be presumed to have done something wrong.
Yeah. Or admitted liability.
Yeah.
Okay.
Whereas
still needs to be proven.
Somebody might be on some. Oh, but you said sorry. Why did you say sorry? Does that mean that you're actually, in the wrong?
Guilt.
Yeah.
Okay.
Yeah.
So I really look. I think communication is key. I think that it really. First of all, I think doctors actually do need to practice safely. I think. There's never been a time to be a cowboy, and I don't think you should start now. You know what I mean? I do think that people actually need to speak to their patients and not, you're a doctor, you're not a vet. You know what I mean? You are dealing with a human being at the end of it. So you actually need to speak to them. You need to speak to them in a way that respects and honors them as a patient, first and foremost. You know what I mean? And when something has gone wrong, say something happens intraoperatively, you need to actually go out and say to that person, listen, this is what happened. It's your duty to do that.
Yeah. Agreed.
It can't just be a case of, you brushing it off and then, go call your insurer and explain to them. No, you actually need to speak to the person. But I mean, I really don't think doctors speak to I went in, I saw my anaesthetist at the door of theatre.
Yeah, it's become the norm. That's what I'm saying. The system, it conspires against the people who work in the system also.
100, and the patients.
Yeah.
Because, and I'm given a form and they're like, sign. I'm like, whoa, scratch this, scratch that, scratch this,
But can I give you my opinion?
Sure.
Working like both parts of the system, I don't think it's the doctor's fault. Look, it is because it's their choice at the end of the day. But there's a lot of things that are being dictated to by like third-party providers.
Give an example. Concrete example.
No, I can't. Then you'll have to do more editing. But if someone's time is a direct translation into how much of money they're making and what they're possibly
talking about perverse incentives. Yeah.
Yes. And it comes from like third-party providers, then this is where now it becomes a situation where the doctor, anaesthetist, is just going to rock up there because he's got a whole ward of patients to go pre-consult. And then you're only seeing your anaesthetist for like 10
But yeah, this is
minutes.
exactly what I'm saying. It's the system.
Yeah.
The system needs to be tweaked.
Exactly. But you can't only point fingers at the doctor and say that.
And you can't generalize. And like patients aren't out there to make your life difficult. They feel like they've been wronged. They just want answers, or they want to be treated fairly in most cases. And it's up to us in between to make sure that the dispute is resolved in as amicable a way as possible.
100%.
Because nobody wants to ever go get treated by a clinician and have an adverse outcome.
Absolutely.
That they want to be fighting over for years. Nobody
Absolutely.
wants.
No, because some matters.
Exactly. I was about to say, except you guys.
No, you guys.
Yeah, not us.
Not us. Yeah.
But it's I think I do agree that the system needs to be tweaked. But I think that at the end of the day, right, until such tweaking happens, the doctors need to, I suppose, go back to the core of what I think it is that they are doing. And what they're doing is treating patients, which comes with interacting with patients. I would, I would get to like Checkers or Pick and Pay or whatever, and like I would have like a miserable teller, and I'd be on some says, you know what I mean? I'm a doctor and I'm up at 2 a.m, and you wouldn't want a sour-faced doctor at 2 a.m. And that's my job, right? That's what I do when I go to work. Therefore, when you are here at 2 p.m, smile. You know what I mean? So until such time that these tweaks are done, as doctors need to do what it is that they need to do, which is treat patients and treat patients well with dignity, respect, and everything else. And whether or not, if what we're saying is that the time doesn't allow because you need to try squeeze in as many patients into your 15-minute consultations while you're charging X amount so that you can actually go home with some money after you've paid your R1 million worth of insurance, you know what I mean? Then we need to consider where the fat can be cut, in the sense that, again, it goes back to the lawyer. In the sense that, do we then need to think about regulating what people can sue for and the amounts that can be sued for, so that the insurance premiums don't need to be as high as they are, so that in turn the doctors don't need to be charging X amounts of money, so that the patients can afford healthcare, so that you can actually spend more time with your patients? Is that where we need to, think about going, or do we just, I don't think it's fair to be on some just work longer hours, less pay. I don't think that's fair, because medicine is hard, right? I think that people should be compensated appropriately, and living is costly, man. So I think we need to think about what it is that we want the system to do, because the insurance premiums we pay are just paying legal costs, and compensation amounts that are unregulated. A CP claim now can go for 20 some odd million rand.
Plus, yeah. Plus.
Yeah. And that's that. It's who has that kind of money in their back pocket as a practicing clinician? So
or as a parent,
you know what I mean?
that needs that money to take care of the kid.
Yeah. But I mean, the bit I'd say now would have to be edited out, so maybe we'll switch off the cameras.
So what do you do for fun? I mean, what's next? Is this consulting thing going well? How's it going?
Yeah, no, so it's going well. It is going well. I think eventually, I'm gonna move into a different direction. Still in the medico-legal space, but it's just gonna get bigger and better.
Okay. Excited. You've got a excited smile on your face.
Yeah.
I don't even know, but it sounds like podcasting is coming up.
So yes. So podcasting has happened.
Yeah, I saw what is it, the first episode?
Yeah. So podcasting has happened.
Everybody's got a podcast.
No, genuine. So
she's getting jelly.
So you guys must also come there and
what is it about?
Yeah.
So mine is more literally just to inform doctors. So it's more educational. You know what I mean? And I listen to a lot of podcasts simply because sometimes you're doing something and listening. You're listening while you're driving, you're listening while you're cooking, or whatever the case may be. But a lot of information I get from podcasts, from YouTube, that kind of thing.
Yeah, I started creatine because of podcasts. But anyway, go on.
You know what I'm saying?
Yeah.
Like, literally, we get so much audio information, and passively so. And so I was like, doctors are busy people. You know what I mean? You don't necessarily have the time to read something. You don't necessarily have the time to go to a webinar, or, conferences are big things you go every now and again. So to get information out there, because I genuinely feel that doctors do need to get more information in, just so that they can feel better prepared for certain eventualities. So that's what the podcast is about. The first episode I did was just about the top 5 tips about getting into 2026. So, making sure your insurance is up to par, making sure that, those kinds of things, that you've reported everything to date in the previous insurance year, that you actually know what your policy wording says. Because
it kind of complements the consulting thing, right?
100%.
It kind of helps. What is it called?
It's called The Legal Clinic.
The Legal Clinic. And where is it on?
YouTube, Spotify, Apple Podcasts.
How did you figure out how to do this stuff? Like, because it's not...
YouTube.
You teach yourself on YouTube, right?
Literally,
That's the same thing I
YouTube.
do. Yeah.
Taught myself on YouTube. And you know what? It literally just confirmed what I was thinking, that we can learn so much from, these platforms. We didn't have these platforms before, but we have them now. So there's actually no reason why we shouldn't use them as best we can.
And anybody can do it, right? Just do it.
Anybody can do it. Just do it.
I mean, that's what caused me to, like, that's what ignited me, or sparked the invite from me to you. When I saw your episode, I'm like, hey, you become a podcaster now. Why don't you come on ours?
Yeah,
I feel like we must all just
Collaborate.
work together. Yeah, collaborate
100%.
and bring
There's
one
so
another
much-
up,
There's so much cake to be sliced up
Yeah,
and shared.
there's
You know what I
enough.
mean?
There's enough.
There's more than enough.
Yeah.
And if not, just bake your own.
Yeah. And it's easy to do. You can actually do it with just a little bit of effort and a little bit of money, because you've got to pay those ongoing Buzzsprout and all that
you
stuff.
really do.
Do you use Buzzsprout, or what do you use?
No, so what's it? Final Cut Pro
Yeah.
is what I use.
No, I mean, like, to host it on Spotify and...
Oh no, Spotify for creators.
Okay, sure,
Yeah.
you do it differently. I use a thing called Buzzsprout, and
No.
it pushes to Apple Podcasts and...
So you can go
Spotify.
directly to podcast. You can go directly to Spotify. You can go directly to Apple.
Is it free?
Yeah.
I'm paying for what then? Yak. And then YouTube.
Can we get you as a professional
We need a consultant,
Yeah.
and like advertising and all that stuff. Do you do any?
So just like on Insta, I have been so bad about it though.
Mhm.
I have been so bad, just because, like I've got a lot of work coming in, so it's kind of like, oh, let me do the work, and then
Yeah, I get you.
know,
I get you.
but I need to be more intentional about actually sitting down, setting a day aside to
But that's a
do
good
stuff.
problem to have. I mean,
That's a
the whole
great
point of
problem to
advertising is to
have.
get the work, and if you've got a lot of work,
100%.
then
It's a great problem to have. I'm very grateful for
Congrats,
that problem.
yeah.
Thank you.
I hope
Thank
it just
you.
grows. And we'll put a link to your podcast.
And
And
thank
do you
you.
have a website for your
I
consulting?
do.
Put
So
all of that in
it's
there.
lawdoc.co.za.
Lawdoc.co.za.
Yeah.
So what do you do for fun? Like,
What do I do
besides-
for fun?
yeah.
My gosh.
Are you married to a doctor?
No.
Okay,
Gosh.
a lawyer.
No.
Okay. Well done. Well done.
Neither.
You
That
can
was
tell
the-
us.
No, so he's a CEO at MTN.
Okay.
Oh, okay.
Yeah.
Yeah,
Jeez,
one of the MTN subsidiaries for data monetization.
All right.
So that's what he does. But he used to be a consultant in a previous life at McKinsey.
Yeah.
Can you ask him, like, my data doesn't seem to be
Yeah.
refreshing every
Can I
month.
tell you, when I told my mom that he works at MTN, she was asking, I'm
It's
like,
like-
Mama,
Free airtime.
he's at group. He does not even know how these
The
things
head office.
Like, you know what I mean? I'm like, he does not know how any of these things work. So it's just like, oh, okay.
Yeah, no, that was a joke.
At least you never run out of data. Right? Yeah, you
No, so can I tell you, our signal at the house is
tops.
atrocious. But the MTN signal works.
I was going to
The
ask. what
Vodacom
network-
signal is
Yeah.
awful. But the MTN signal, like, it's just,
Are you with Vodacom?
I'm with
MTN?
Vodacom, of course.
But it really depends. Are you with Vodacom?
I'm with Vodacom.
Bro, I never accept that in my
Yeah.
household. Vodacom is like the Samsung of...
I love.
And I use
I've
Samsung.
moved from
Oh,
lots of
no.
things. I've moved to MTN once, and then there was no signal in the basement of work. And how I know this is because when I was doing articles,
Yeah.
I was so embarrassed to make phone calls in front of people.
You were going downstairs.
Because remember, I left dentistry and I went to do articles,
Yeah.
right? And as a dentist, you don't phone people and have
No.
conversation. I was so awkward. I used to go sit in my car and like phone, like,
people,
whatever,
whoever.
Yeah.
And that's how you found
I'm
out
so
there's no signal.
self-conscious.
What, like clients?
Yeah. I was so
But
self-conscious
it's
about it.
it's such an interesting thing, because I completely know what you're talking about. Even when it comes to like writing stuff,
Yeah.
like emails and letters,
Nobody teaches you that.
nobody teaches you that. And like I remember, it was a case of learning how to write in full sentences.
Not even that. Like, to kindly see, like, we just want to write, please, whatever, do it.
Do it. Like there was no
Etiquette and,
floweriness.
yeah, all that
You know what I mean?
nonsense, yeah.
Exactly. So that was definitely a learned skill.
Big learning
Um,
curve for me.
And even just how to like speak to people, because to this day, like if I want to ask you for something, I'm gonna be on some hi Ash, da 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 da,
Yeah.
and then how are you?
Yeah.
You know what I mean? Because you just want to get the business out.
Yes,
You know what I
yes,
mean?
yes.
Because it's time sensitive.
Although that, how are you thinking? Like when somebody messages me on Teams and say, "Hey, Yash, how you doing?" I'm like,
Literally, just ask me what you want.
The first message should just be, "Yash, can you please send me
100%.
X, Y,
I'm the
Z?"
exact same way.
And then at the end, by the way, how are you?
Yeah.
I hope you're well. Don't even
Actually, I
ask
don't
me
care.
how I
Yeah,
am
you know
because
how
you
I
don't
am.
really
Yeah.
want to know,
Exactly.
do you?
Yeah.
So just say what it is that you need, and let's get over and done with it. That was a huge
Yeah.
learning curve. Like, it was very frustrating in the beginning.
Yeah. Exactly.
It was super
I
frustrating.
hated it. I hated having to make phone calls. I wasn't used to it. Yet, you see, you won't know because you've never had to do this, right?
Make phone calls.
No, I mean,
Like professional phone calls.
like, yeah. Yak is always bossing people around.
Yeah.
It's
And the other thing about it is like the hierarchy in like the medical field as opposed to the legal field. The legal field is so it's weird.
yeah.
You know what I mean? Whereas in medicine, you know that you have an intern, your ComServe, your MO consultant all the way, right? And the work gets different as you go up. You know, it gets more complex. As a lawyer, you're doing the same thing on day 1 as you're doing on day 3,000. Your 10,000 hours just buys you a quicker route to that final outcome. But you're doing the exact same work on day 1 that you're doing 10,000 hours later.
Except delegating more. It doesn't get like...
It doesn't.
Once you make partner, it's not like, oh, suddenly you just
you don't draft something just because you've made partner. Whereas if you're a doctor, when you're day 1, you can't, you can't take out an appendix.
Yeah.
You know what I mean? 3 years later, you can take out an appendix.
But wait, I have a question for you guys. Am I allowed to be a lawyer?
No.
Or wait, if I get sued for anything, right, whether it's criminal or not,
Yeah.
I can be my lawyer. I can represent myself
Of course
if I
you
want.
can.
Yeah.
Whether you should.
But there's a saying, right?
Yeah, doctors and lawyers. A doctor who treats himself as a patient is an idiot of a patient.
Yeah.
And I think a lawyer who represents themselves,
Because it feels
as
like
a fool for a client.
society is just going around doing whatever they're supposed to do, like just doing their things. It's only lawyers who know what you're actually not supposed to do.
Yeah, maybe with a bit of ChatGPT, everybody can come and know something.
Yeah, Claude.
Yeah. So technically speaking, we all can be lawyers.
Look, I honestly believe no one was born anything. You become.
All man-made.
Yeah.
Yeah.
Think about it. Except like medicine's not not everybody can be a doctor.
No, I beg to
Well, you're not
differ.
allowed
be
to.
taught. You
Like
gotta be taught.
legally, you're
No,
not allowed.
but what I'm saying is just that no one is born anything.
Yeah, exactly.
You have to
Guys,
become
I'm
whatever
talking
it is.
about literally. Like,
No, you could.
like I cannot go and say I'm going to go take out an appendix. I'll get sued. But
or you'll kill someone.
But I can come and do like your job.
No, you can't. You can't represent other people.
No, not other people,
No,
but myself.
So you could represent yourself, even though the judges will tell you, "Are you sure? Are you sure?"
Am I allowed to take out my own appendix?
No,
You can.
Legally.
that's
can.
ill-advised.
I mean,
Not ill-advised, whether it's legal.
I don't think it's unlawful to like.
It isn't unlawful to try to take out your own appendix, but
probably not.
let's think about how you do that.
Like I know people that have
This isn't
extracted
like
their own teeth and stuff.
Yeah,
You know
but
that.
this isn't like you're amputating an arm
Or a finger.
or a finger. Yeah, but you're also auto-amputated, so you know.
No, I had to physically go in for an amputation.
Oh, see. But it's not like you could you would have an easier time sitting with a spanner doing this than trying to dig out your appendix awake.
Yeah.
Because that's what you would have to be to dig out your own
course,
appendix,
yeah.
right?
Don't
We are
let
sidetracking,
Don't let Yak sidetrack us with stupid questions. I mean, did we get an answer to the what do you do for funding?
I ran after my son. He was a very busy little person, but before he came around, I enjoy eating out. I enjoy going to the gym. I really enjoy going to the gym. What else? I have a very close circle of friends. Like I have very few friends. And just spending time with people. I enjoy that. At least those kind of people. I enjoy spending time with my family. I've become a homebody, off late. I'm not so much out there. By homebody, I don't mean literally sitting at home, but just more chilled.
You don't
Oh,
have to go out.
Yeah,
if you
no, I don't have
want
to. Oh, but like a music festival.
We're getting old.
No.
Oh, you like music?
Oh, what
festivals?
music
I
festival?
cannot. I
Like-
cannot.
Music festival, concerts.
So you've got the energy for all that.
Listen, I do like
What's
I
your
think
type of music genre?
so old school R&B.
Okay.
I don't know anything that was released. I think after 2010.
Old school R&B. Do they listen to that in Limpopo?
Listen, we grew
Wow.
up writing those like in a music book. You underestimate us.
Tony Braxton and all that.
Listen, and I was there when she came to South Africa. I
Oh.
love Tony.
Yeah.
So yeah, I think 6 weeks after having my son, I went to a music festival. My mom was just like, "Are you nuts?" I was like, "Nope,
Yeah.
I'm
Yeah.
going."
You got energy. Yeah.
No, actually, I really love music. So like just the being able to be.
Me too, but I don't want to go to festivals. Like I'm not.
Oh, really? You're missing out.
I don't have the.
Yeah, I love it.
No.
Love it. Yak goes and records at festivals like commercially.
Oh wow.
And who were you recording with recently?
Anjana Deep. Oh, and Ben Boma, and that's why when you said
What
music
kind of
festival,
Pearl Tusi was
music
somewhere?
is? What kind of music festival is?
that's more like EDM,
Ah,
like soft rock type
Yeah.
of stuff. Oh yeah, and in Amstel, I shot at Amstel.
okay.
Yeah, with
Um,
Pearl Tusi, and she's a DJ. And
Yeah.
Yak is celebrity, you know.
No, I mean I'm
Big
finding
shot.
out. No, I saw the hair. The
Yeah.
hair is like
Oh,
super cool.
The hair is a celebrity on its own.
Yeah,
That
no,
hair-
the hair is like
We must start an Instagram page. Just
no,
for the hair.
honestly, the
Yeah, I
hair
get
is-
trolled hard, eh? for
No,
the
but your hair is like
yeah.
really cool. Like it's
Don't
Just-
encourage him, please. You're saying all
the
this
hair
now.
is cool.
He
I'm
needs
gonna
to have
leave
the
it.
Let's
haircut.
face it,
Nah.
Yash. The hair is cool. Like let's leave it at that. The hair is cool. He has my stamp of approval.
Ha,
It is
in
cool.
your
No,
face
no, no.
and the trolls.
Don't listen to the lawyers. If your son comes to you one day later on in life and says, "Mom, I want to be a doctor," do you have any advice for me?
Yeah, take a gap year, and then come back after a gap year. And if you still want to be a doctor, for sure, go for it. Go for it. But I'm not paying for a year's first year straight after matric.
Trial and error.
Unless, of course, because you get some people who've always known what they want to do. You know what I mean? But as a parent, you know your kid. So if you can see, this one, isn't sure about them, then no, just go travel.
Well, at least the privilege is getting passed down generation to generation. Because a gap year is a privilege thing.
Listen, my parents were just like, what? No, not a chance. Because my friends were doing gap years and then they were going to study sports science and IT. And
But a gap year doesn't necessarily mean you're doing nothing. You can go get a job as being
100%.
gap year.
You know what I mean?
Then that's not privileged.
So, but I mean, it kind of is because
Kind of is, yeah.
not having a gap year means you enter the workforce early, on time, so to speak. So the fact that you can delay that is in and of itself a bit of a privilege. So
Definitely. Well, Nina, thank you. It's been fascinating.
it's been fantastic.
Yes,
It feels
thank
like
you.
a conversation with
I know.
friends.
Yeah.
Good.
I feel like saying thank you, Your Highness.
Stop it.
Thank you, Princess. Yeah. Much appreciated.
Oh, with the arm and everything.
Yes, yeah.
You guys are so silly. You guys are silly. Oh my God.